All right. Good morning and welcome to House Education Policy and Administration. Before we open our hearings today, I would request that Representative Terry lead us in the pledge.
I
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you for bearing with us. We had a few technical difficulties as people are introducing bills in the Senate and need to make their way over. And thankfully, we have someone stepping in as clerk at the last minute. Thank you, Representative McDonald. With that, I open the hearing on House Bill 433, establishing the Seizure Safe Schools Act, and I call on Senator Lang to introduce his bill.
Thank you, Madam Chair. Thank you, committee members, for taking my testimony. I'm Senator Tim Lang from Senate District 2, serving the Lakes region. In the Senate, I serve on the chair of the Ways and Means Committee, vice chair of the Election Law Committee, on finance, and chair of JALCAR. And I just got appointed this week to ED&A as well. So I serve multiple committees over in the Senate. I'm introducing this bill, Senate Bill 433 FN, establishing a Seizure Safe School Act. So a couple things. This bill was brought at the request of the, oh, no, I drew a blank on the group's name. Epilepsy Foundation. Thank you very much. It wasn't Alzheimer's. That's what I was having. It's epilepsy. They approached me last year about this bill to bring it in, and it just requires some training requirements at a school level. And I was immediately drawn to this bill for one simple reason. So back in the day, I was when I was serving on the school board, I also was a coach for our soccer team in the JV squad in the high school. And in the middle of practice, I had a student member drop and go into a seizure. I had no training on what to do other than basic first aid and some of the things I was doing. And so we immediately sent a student to go get the trainer. Well, you know, we did what we thought was best for the student having no direct training. So it was rather frightening being a person in charge, not having any experience or any training whatsoever and trying to do what you just think is best. So this bill just requires some training, has somebody on site that's trained, provide training services to staff members that are in the school. We know that 1 in 10 Americans will have a seizure during their lifetime, and that's 1,500 students in New Hampshire have epilepsy. This bill just helps develop action plans for students with epilepsy, ensuring the administration of appropriate FDA medication where necessary. Again, I'm not going to go into this. I mean, the bill is pretty straightforward. It's a training bill, requires that they provide some training in schools so people aren't put in a position I was put in and have to try to manage this with no training whatsoever. That's it. I know we have a lot of people behind us to speak, so I'm going to limit it.
Yes, thank you very much. Are there any questions? Yes, Representative Balboni.
Thank you, Madam Chair, and thank you for taking my question. I'm just looking at the fiscal now at the end. And it's all indeterminable. I'm wondering if when you went through and discussed this bill with the Department of Education, I'm not against the bill at all. I'm just trying to get a handle on how much extra training and resources would be required for it to be implemented at the local level. And if you don't know that, maybe there was somebody else that could discuss that.
So one of the reasons it's indeterminable, it depends on how the school district chooses to implement training. If it's done on a professional development day, if it's done as part of, as you know, most teachers have a 185-day contract for 180 days of school. There's before and after that they are able to, so it doesn't know if you're going to provide training during that. It's a 75-minute training every other year. So it's not a heavy implementation. It's not a heavy lift for school districts. And again, 25 other states have already implemented this across the country. And so again, I don't think this is a heavy lift for locals to be able to provide 75 minutes of training every 2 years somewhere within their time span that the teachers are there.
Representative Cornell.
Thank you. Thank you for taking my question. On page 1, line 25, it says the presence of a full-time school nurse shall serve. I don't, is this saying that if if a child in the school has epilepsy, there must be a full-time school nurse because many, many schools don't have full-time nurses.
No, absolutely not. But it just says that for the training purposes, someone should be trained in this, and if a full-time nurse is there, then they qualify.
I do have a question, Senator Lang. What kind of training are the school personnel supposed to get, and where would they get it?
So how about I'll let the Epilepsy Foundation, because they do provide the online training as well for these services, so they'll probably be better to answer the
Perfect,
question.
thank you. Any other questions? Representative Hall?
Thank you, Madam Chair. Thank you for taking the question. So this is only requiring 2 people?
Correct. 2 school employees, at least 2, so minimum 2, at each school to have training.
Follow-up. So one of them would be the school nurse if there was a full-time
Could be.
nurse, so it's another person. So the scenario that you gave with the coaching, would this have helped you? If the-
Sure.
you're on
Again,
the
well,
field?
number one, hopefully that there was some training, they'd offer broader training to people, but also for awareness. And then secondarily, just making, if we had somebody, like in my case, I sent for the athletic director, who the trainer that we have on staff, that stays after school when we have extracurricular activities. So again, I would suspect that they would have someone like the trainer who's going to be available both during the school times and after school times available. Again, it's up to a local school board to direct who that might be. They may designate somebody else. In my case, it would have been the trainer,
It could have been, in this case, it could be the trainer and the nurse, and then they're all set.
and they're all set.
Thank you.
Representative Woodcock?
Thank you, Madam Chair. Good morning, Senator Lang. Just going back to the follow-up on Representative Hall's question, I'm looking at lines 9 and 10 and 11. When I read this initially, I was thinking that it was everyone in that category, and not just 2 people in the school. I was thinking how much sense it made that everyone be trained in that, particularly every coach, because often on fields far away from nursing or, particularly during practice, nursing and or an athletic director or a trainer, because since nursing, the schools close at 2 and they're gone, or 3, whatever it happens to be, and the athletic trainer with multiple schools, multiple sites, not going to be there. So I thought when I first read this that it was about every person.
It is. I apologize. So you are correct in your reading of that. Everybody should be trained, but the requirement is that in section 1 is that each public school and governing body of each private school and charter school shall have at least 2 in the school that meet the training necessary, right? So while you train everybody, there has to be 2 at least that's available, for lack of a better phrase. And maybe I'm reading that wrong in the epilepsy. I'll be honest with you, I introduced this bill 4 months ago in the Senate, so I don't quite remember.
May I mention?
Follow-up?
Thank you, yeah. Because it's just different than what you just told Representative Hall. There's only 2. I think so the clarity clearly needs to be clearer. Thank you.
Any further questions? Oh, Representative Litchfield?
Thank you, and thank you for taking my question. This question was already asked of you, and I'm sorry it's early, so I just want to make sure I understand. On page 1, lines 25 and 26, when it says the presence of a full-time school nurse shall serve as one of the school employees required under paragraph 1 of this section, I keep referring back because my perception was that you said that they be part of the training, but when I read it, I keep interpreting it as the school have the presence of a full-time nurse who is trained in helping out in a seizure situation. Can you clarify that, please?
Sure. So again, on line 9, it says training will be given to everybody: principals, guidance counselors, athletic directors, teachers, and other relevant school personnel with direct contact and supervision of children on the recognition and signs of seizures, right? So everybody gets the training in that category, right? If you go on to section 1, it says, again, by the end of the next school year, the board of each school district and governing body of each private school or charter school shall have at least 2 people. So at minimum, you got to have 2 at each school that meet the training requirement. As part of that, the subsection there says that it talks about what they have to be, for lack of a better phrase, trained in, the training requirements. And then in section 2, it just says to meet the 2 people that are required in section one of them could be the nurse. That's if you have a full-time nurse, they can meet that requirement. So of the two people that's mandated to have at least two in each school, one of them can be the school nurse and you can have somebody else. So that just, again, it's training for everybody, but you have to make sure there's at least two people at school that have the training, one of which can be the nurse. Does that answer your question? Sort of.
Another one though, may I?
Follow up?
Yes, if I could just, actually it's a different question. Okay.
You can ask a different question, Representative Litchfield.
Thank you, appreciate it. My next question is, again, echoing what others have said, I'm not questioning the importance of this, please don't misunderstand me. We had a bill come before this committee and it crossed over to the Senate where we talked about, instead of having suicide training annually, we talked about doing that every other year. So I'm not saying that this isn't important. My concern is I've heard people come out and say that they're being deterred from, it could be even volunteering for different things because of all the trainings that we are assigning. And I understand this has touched you personally, but why this? Why this specifically? Oh, because I think that there are hundreds of training that are incredibly important that we could do. And we've been trying not to fill up the PD with more and more trainings that are required.
Sure. So again, as I identified, 1,500 students in New Hampshire have epilepsy. It's not a small number of our population. 1,500 students have epilepsy in New Hampshire would be subject and are subject to possible seizures. Not knowing how to handle that can actually cause harm to the child if you don't deal with it right.
Representative Freeman?
Thank you, Madam Chair, and good morning, Senator Lang. Thank you for taking my question. Can you elaborate on what schools currently do if they have a child that experiences a seizure?
I'm sorry, can you repeat the question? I couldn't.
Not a problem. And isn't that funny? You couldn't hear me. Do you have knowledge of what the current protocol is in public schools for a child that has a seizure?
Do I know what the protocols are? No, I do not.
Thank you.
And again, Representative, just to your point, the point of this is to make it a uniformed protocol, right? So all schools have a protocol, have a process, have a policy for this 1,500 students that could be having issues.
Representative Hall?
Thank you, Madam Chair, and thank you for taking my question. On line 30, page 2, the exclusions. So it only applies to school that has a student enrolled who has a seizure disorder. So my question is, what if they haven't been diagnosed yet and they have their very first seizure? Now, nobody in that school is trained? I'm just curious. So line 30.
I'm sorry, give me 1 second. Let me read the line incompletely. This, so your question is if it's an undiagnosed issue?
Right.
Again, I would hope that schools would uniformly do this anyway, because teachers don't know who has a medical disorder and who doesn't have a disorder. So, and you have to deal with students that are coming to your school for sporting events and everything else. So again, my goal would be that every school adopt this policy and every school provided 75 minutes every other year to anybody who wants to take it.
The follow-up?
Yes, follow up.
Thank you, Madam Chair. So are you suggesting that maybe that shouldn't be there?
No, but again, I'll let the Epilepsy Foundation, again, some of this is model language that they brought to me and that they've executed in other states. And I think some of that was to manage objections to the bill.
Okay, thank you.
Representative Woodcock?
Thank you, Madam Chair. So I had the same highlighted notice, and we hadn't talked either. Great minds, I guess. But following up on Representative Hall's start, I just want to go to line 32 and line 33. Why is the requirement to have that to be approved by the United States Food and Drug Administration?
Sure, I'm assuming, so again, I'm going to make some assumptions, and I'm sure they'll correct me behind me if I'm wrong. But again, it probably has to do with what nurses are allowed to administer and not allowed to administer for medications. Because part of the, again, if you look at earlier on the bill, some of the, on page 1, line 16, part of the training, right, shall be meet the training requirements to administer, assist with self-administration of medications, right? So I think the idea is that we don't want to be giving non-regulated, non-medications to students that may or may not have defined protocols.
I'll leave it at this, but this says the student's healthcare provider. That's not the nurse, that's the doctor. Thank you.
Any further questions? Thank you, Senator Lang. We have 8 cards of people testifying in support. So if you have something to, just try to keep your testimony as brief as possible. If it's something that has already been said, then you can say that it's already been heard by a previous speaker, but we certainly aren't limiting your testimony in any way. So I call on Kristen Gordon.
My name is Kristen McCollum-Morgan, and I'm representing.
How's that? Wonderful. My name is Kristen McCone-Gordon, and I'm representing Epilepsy Foundation New England in support of Senate Bill 433. I just want to quickly thank Senator Lang. We are so appreciative of his support and the support that we've received from so many co-sponsors on this issue. Like to thank our bill sponsors and most importantly, the New Hampshire families joining us today who are bravely sharing their stories and their struggle in the hopes of making the path safer and smoother for those coming up behind them. It's an honor to be with them, and it's an honor to be with all of you. I have submitted detailed written testimony to the committee, so I won't go into great detail here. What I'd like to do is just share some very high-level points on what's in the legislation, why it matters, and then you will hear the perspectives of current and former New Hampshire students, the parents that love them, as well as a service provider and school board member. But first, some context on our community, and I will try my best not to repeat any statistics that you've already heard. I think the most relevant statistic to this committee is that seizures are the 3rd most common medical emergency in schools across the country. In New Hampshire, as the senator mentioned, we have over 13,000 New Hampshire residents living with epilepsy that we know of today, and over 1,500 of them are school-aged children. The bottom line, as we see it, is that these statistics show that seizures are not rare events. They are recurring medical emergencies happening in our schools to New Hampshire families, and you'll hear from them today. Onto the problem that this legislation addresses. When school personnel are not trained to respond, and Representative, I think this gets to your question earlier, the consequences can escalate rapidly. Delayed treatment increases the risk of prolonged seizures, which can lead to brain damage and death. By contrast, the research is very clear. Timely administration of seizure rescue medications can stop a seizure, prevent costly and scary hospitalizations, and save a life. We cannot emphasize enough. A prompt, appropriate response to a seizure is essential, and schools must be equipped to provide it. So what is included in the legislation? There are 4 practical, low-burden pieces to this bill. The first, as you heard, is that it requires training for school personnel. It's seizure recognition and first aid training for school staff. It's very important to note this is provided completely free of charge from the Epilepsy Foundation of New England. There are online courses, there are in-person courses, whatever the school district prefers. We have modules geared towards school nurses, classroom teachers. I don't want to misspeak, and I can get back to the committee on this, but I also believe athletic directors as well. So the whole range of adults who are in charge of students have an opportunity to be trained, and it's free of charge and as easy as possible. And I should say it includes continuing education credits as well. The second part of this legislation is that it requires seizure action plans. These are individualized plans made by their physician and the family with clear steps for how to respond should a student have a seizure in school. It ensures consistency in emergencies, and you will hear today from parents and students as to why these plans are so important and what happens when they're not followed, and they're not always followed. Third is medication access. It ensures FDA-approved physician prescribed seizure rescue medications be admitted in schools. We just want to make sure that the students are getting the medications that their doctors want them to have, to answer your question, Representative. And last but not least, there is an awareness and education piece to this. It requires age-appropriate epilepsy education to reduce stigma. You will hear from a current student and a former student as to why this issue is so important and how much change it can really make in a person's life. As I mentioned, I've submitted written testimony. I'd like to cede as much time as I can to the families who came here in support, but we believe this bill is a common sense, life-saving policy. It ensures that a medical emergency does not become a tragedy. Happy to answer any questions you have, and I very much appreciate the opportunity to testify.
Thank you very much. Representative McDonald.
Thank you, Madam Chair, and thank you for being here today. My question relates to the exclusion section that was brought up earlier, and the response was that it might be model language or it was worked in other states. Do you have any idea as to why we would want to only train if we know someone has a seizure disorder and not just everyone?
That's a great question, and we appreciate it, and I'm glad that it came up. We would love for everyone to be trained. Seizures can happen. 1 in 26 people will be diagnosed with epilepsy. 1 in 10 Americans will have a seizure, and not all of them will have a seizure action plan. With the amount of time that students spend in the school, it certainly can and does happen that a child will have their first seizure at school. We would love to have everyone trained. It really is what the senator said. It's a implementation issue, but we would, we are here. We are willing to provide any training schools need, and it's an excellent point. Thank you.
Representative Hall.
Thank you, Madam Chair, and thank you for taking my question. So these kids have action plans. Mm-hmm. Are all plans different, or just to treat an epilepsy from a teacher's point of view? Are they going to do the same thing for every kid, or are they got to go check the action plan to see what we need to do? Because they don't have the meds, right? The nurse probably has those meds. I'm just curious, does every kid get treated the same with this, or is everybody different?
There are certainly some consistent patterns, and I would defer to the parents because you'll probably hear how their seizure action plans are slightly different. So it depends on the student. Everyone's medication dose is different, but there are certainly some consistent themes throughout all of the seizure action plans. But to answer your question, it's specific to the student.
Okay, thank you.
Representative Litchfield.
Thank you, and thank you for taking my question. I'm going to do my best to wrap 3 into 1.
Sure.
Okay, to keep it simple. But my question is, when I'm looking at this bill, it looks to me as though the training is every 2 years. It's not a once and done. So I wanted to ask you, how would you feel about it being done at the time of hire, with a new hire, right? Let's say within 30 days or 45 days of them being hired in the school system. Also, anyone that's current staff, let's say they have it done within their annual training, and then that's it. And could this training be coordinated into any of their other trainings? And is 75 minutes necessary? Could it be a shorter training?
I will have to get back to you with an exact response on that. I do know that we can have shorter trainings, and we have different modules at different lengths. As to whether it's every 2 years, that is certainly ideal and the safest option. But having it once at the time of hire is certainly safer than not having it at all. But the safest option, given the consequences of what can happen, and how simple it is, and I'm not trying to say that taking any time for teachers who have so much training already is a simple answer. But this is a life or death issue, so we recommend every 2 years.
Representative Woodcock.
Thank you, Madam Chair. Nice seeing you again this morning.
Yes.
The question on the plan. In following up on Representative Hall's question, basically, if each plan is different, the one application has the medication, you were talking in the piece about the medication, the government approved or health provider approved, hopefully federal FDA approved. Does the youngster carry that with him or with her? And if they don't, after school, when, because those people, and you're on a different field, how is that applicable? That's part of the, and the second part is the legality of the privacy notice. Senator Lang was talking about that, every teacher would know. So is this information going to be provided to all school staff, these youngsters all have seizures, or is that a violation of their rights?
So I want to get back to you about the legal question. It's our intention that every adult who is responsible for a child with epilepsy would have a copy of their seizure action plan. We think that's really important, from the classroom teacher to the library teacher to the recess monitor, or whatever the position is called. But if I could, Representative, get back to you with a
Okay, that's fine, yep. About the second part though, if my,
carrying medication.
yes, thank you.
So most of the time it's with the school nurse. I understand in New Hampshire, there isn't always a school nurse. So I'll have to look in to see in those cases where their medication currently is. I don't know. Typically it's with the school nurse.
May I just clarification now. I bring that up because as Representative Lane used his example, he was on an athletic field. And, anything else, all these things happen when there are the right people around. So my concern is if we have a requirement to train, a requirement that they administer, and yet it's not available, particularly at school plays, school functions, or athletic complexes, that it makes it almost useless because they don't have what they need. That's the question.
I think that's a really good point, and I'll get back to you with more clarity.
Okay, thank you so much. Thank you, Madam Chair.
Representative Balboni?
Thank you, Madam Chair, and thank you for taking my question. Could you speak to a little bit to any data you have on how seizures are currently being treated in the schools in New Hampshire? I know that schools have various policies that they already are in effect. Is the intent of this bill, I think as Senator Lang said, to make it a universal policy? Because again, do you have data on what schools are doing now in regards to this? And the second one is really easy. I'm not seeing your written testimony, so did you submit it online? Or?
I did, yes.
Did you get it? Okay, thank you.
I submitted it yesterday online.
Representative Cornell?
Thank you, Madam Chair, and thank you for taking my question. In regards to a seizure action plan for every children, I don't know this, there are children with epilepsy sometimes put on a 504 plan so that each one has their own plan that I think in that case is very shareable with their teachers.
That's an excellent question, and we've received that a lot in other states. The answer is no, and that's also included in my written testimony, but I'd love to address it as well. This is about emergency response, not academics, and not every student with epilepsy qualifies for an IEP or a 504. I would also add that we found that requiring 504s for basic medical response would put a significant administrative burden on 504 and IEP coordinators as well.
Thank you.
Of course.
Representative Terry?
I think this question becomes even more relevant with more of the questions and answers that we've heard. When we have a situation where there's a coronary event, and we've had testimony, we've had bills with respect to defibs. It's pretty easy to kind of see how that would work out in most cases. Could you walk me through how, given all of these individualized situations and medications and so forth, could you walk me through a hypothetical where a student has a seizure in the lunchroom during the lunch hour? Could you walk me through what would happen in that scenario, just as one example of how this would be addressed in a school?
If I could, I'm happy to hypothesize, but we do have current and former students here and their parents, and I would love for them to be able to give you their lived experience, which I think would probably be more helpful than mine, if that's okay with you.
It would be helpful to hear the hypothetical, because I'm not sure what we're going to hear as regards individual situations.
Sure.
I can't anticipate that.
Sure,
Thanks.
no problem. So in an ideal world, and this is not happening consistently right now, in an ideal world, if a student had a seizure, depending on the type of seizure it is, The lunch monitor, the classroom teacher would be aware that the student had epilepsy. They would know how to do basic seizure recognition and first aid response. They would know where the medication is, to your point, Representative, and have it ready, administer the medication. There would be no need to call an ambulance. They would keep the student safe. The student would recover from the seizure, take some time to recover as needed, and then go back about their day. When that isn't in place, and I don't say this to be dramatic, but it can have significant consequences, including brain damage, ambulances called, hospitalizations, and unfortunately death.
Follow. So in the situation that you've just described, and we're perhaps in a lunchroom with 250 students, this is immediately, the way you've described this to me, is it's immediately recognized, and treatment comes within a matter of how many minutes if everything goes like this?
Within 5 minutes.
Within 5 minutes.
And if I could add,
Yeah.
Representative, not only would the teachers be aware that the student has epilepsy and know what a seizure looks like and know what to do, the students at his or her table will have training to understand what's happening to their friend, which can be a traumatizing experience, particularly for elementary school students. So there would be total awareness of the situation, much like if a student is diabetic or had other issues that, could show in physical form. The awareness would really help. They would get their rescue medications. It would save a lot of agony going to a hospital for a young child. It's a scary experience, and a lot of financial resources as well. Yeah.
Representative Hall.
Thank you, Madam Chair, and thank you for taking my question. So you just said the students would have training. Who's responsible for that?
Epilepsy Foundation New England provides that free of cost. It's part of the fourth part of the bill, which is awareness training. It's age-specific modules that we provide to classroom teachers.
Oh, so ultimately, the administration is the one that has to figure this out, right? I mean, so you offer the training. This is mandating the training for students as well then. If the child, because in the lunchroom, it's not the same kids at the table every day, right?
Right.
So basically, it sounds like every child needs to be trained, every teacher needs to be trained. Yep.
We believe that could only help.
Yep.
Yes, and we provide the training free of charge.
Okay, thank you.
Representative Woodcock.
Thank you, Major. Just two clarification points. One to follow up on Representative Terry's question, but I didn't, when you mentioned the student that jumped, as you can see, two former teachers, I didn't see anywhere in here where it says training students.
It's the fourth aspect of the bill, and it's,
Can you tell me what that is?
sure, it's awareness and
No,
education.
where it is in the bill.
I don't have a bill in front of me, but I can get the certain line
Maybe
items
send a
for
link.
you.
I hadn't seen that when I read the bill prior to coming to the meeting. I haven't seen that all the students being trained.
Representative Woodcock, I believe that's on page 3, line 5,
Thank you.
or at least it begins there.
No, I meant I'm sorry, Madam Chair, I'm talking the part that says that they have to train every student. I see page 3, line 5, that's on the seizure program.
As I read it, that's the only part that looks like it would apply
Okay,
to your question.
thank you.
Any further questions?
Only just one, let's go back to Representative Terry's issue. How long before, it's hypothetical, or I'm going back to Coach Lang on the field, how long before the medication has to be or should be administered if in fact you're in a situation where you're more than 5 or 10 or 15 minutes away from the nurse, or it's after school and the school nurse facility filled locked up?
I'm sorry, I didn't hear the last part of your question.
It's in the case that Representative Terry gave, you were talking about school lunch area, and I'm from a big high school. It's, hell, it takes more than 5 minutes to get back to the school nurse office to find it. But in that case, that's the time frame. And I understand what you said. The longer the delay, the more. I get that. But if we're after school instead of a Lang scenario, and the school nurse's facility is locked up, and there's nobody there to the coaches, and they're out in the field all over the place, what happens?
I would imagine, and I don't want to misspeak on this, so I will definitely get back to you on your previous question. I would imagine the student would have the seizure rescue medication in their bag. It's critical that they would receive the medication within 5 minutes.
So they do,
And then chances go higher.
okay, just some clarity, because I asked you before if they carry it, and you said you didn't know, but now you told me it's in their bag?
That's what I meant when I said I want to get back to you with clarity. I would assume it would be in their bag. I don't want to misspeak. I can
Okay.
certainly get back to
Thank
you.
you, Madam Chair.
Yeah, thank you. Any further questions? Seeing none, thank you very much. And I did look, your testimony is online for anybody who's looking for it.
Excuse me, Madam Chair, would it be possible to have Ms. Wilson come up and answer a lot of the questions that we had in terms of what's current?
She's already submitted a card. She's the one step ahead of you, Representative Alboni.
Thank you.
Lee Prince?
Can you hear me now? Hi. My name is Lee Prince. I live in Lyme, New Hampshire. I wear several hats. I am a related service provider in schools. So as you asked some of these questions, I have some lived experience from that role. I'm an elected school board member, and I'm also a parent of a child who has epilepsy. I'm gonna try to be quick. The reason of the why is I live 12 miles from Dartmouth Hitchcock Medical Center. The day after my son was diagnosed with epilepsy, he had a 40-minute long seizure. Our fast squad was there within 5 minutes. The ambulance came from the town south of us with EMTs. Our rural districts have volunteer fast squads. A paramedic was needed to carry, only paramedics carry the medication and administer it. So nobody was available to give it. I knew there was a medication to stop it, yet living that close to Dartmouth Hitchcock, we were intercepted by a second ambulance from another town en route to the hospital, and a paramedic jumped on board. So in many New Hampshire communities, we can't assume that emergency response will arrive in time with the level of care required. And I think that's really important to know. So preparedness in the schools is really essential. As an educational professional, firsthand, I know how critical it is to handle seizures in the school environment calmly and with knowledgeable actions. Many staff lack training in identifying seizures and responding to them, except for maybe getting the school nurse, if there's one there at all or nearby. I think and in those first moments, it's critical. That's where uncertainty is. It increased risk, not only for the person having the seizure, but for all of the other students witnessing the event. The way the adults respond in those critical moments shapes both the safety outcomes and the social, emotional experience of the whole school community. When staff are trained, they're able to act calmly and effectively, and just as importantly, they're able to help students process what they just witnessed, which reduces fear and stigma while enforcing understanding and compassion. SB 433 provides a structured, consistent approach to addressing the need. The elements of the bill are consistent with existing frameworks for managing other medical conditions in schools, like anaphylaxis and asthma. The bill doesn't necessarily create an entirely new system. The New Hampshire School Board Board of Nursing and School Nurse Association already have standards of practice that support delegation of medication administration under appropriate conditions. The Department of Ed also clearly defines the authority and structure for medication administration. But without consistent implementation and training requirements, there remains variability in how students' needs are met. From a systems perspective, this bill supports equity. As the legislature continues to try to expand school choice and discuss open enrollment. A statewide standard ensures families are not limited in their choice based on whether a school has the capacity or willingness to safely support a child. So ensures that all students are afforded the same level of care and protection regardless of where they attend school. I will say my son, who is now 25, had a seizure action plan. You need to know not all seizures are the same and not all require the seizure rescue medication or vagus nerve stimulator. Most seizures will stop within a few minutes. So the essential piece that all staff should know, and all people and all kids. My son used to train his own classes or educate. He did classes on it in health class. In his 5th grade class, we did a program. If someone has a seizure, you turn them on their side. You don't put anything in their mouth. You don't hold them down. You put something soft under their head. You time the seizure at minimum. If a seizure, most of the seizure action plans I have seen as an educational professional are something to the degree of if it lasts for 5 minutes, that's when you administer the medication or do the, or if they have a cluster of seizures. So they are all different, but the medication administration, the types are there's certain things. They're either oral, they're nasal, or they're, so my son was an athlete, and that was one of my biggest fears after that 40-minute seizure. If he's on a bus going to a baseball game in the middle of nowhere in New Hampshire, and the fast squad that comes is all EMTs and no one can support him, I need somebody on that bus. I need that coach to know he might have a seizure and what to do. So for him, he had a set in his bag when he was younger. If the school doesn't want him to carry it, then the coach would need to carry it or somebody would need to carry it. But that gave him access to be able to play baseball with his peers. So I don't know if you have questions for me.
Any question? Representative Woodcock.
Thank you. Just 2 questions. You said you're on the school board, right?
I am on a school board, yes.
Okay. So I'm assuming that this is still under the local control of the school boards in terms of there's no law that says they have to do it, so you could do that. Does the school board that you're on have a program of training for your staff?
I don't believe so. A general one, no. There are trainings that school...
I mean, for this specifically.
For this specifically, I only know as being a parent in that district that when my son was there, we did trainings. I do not know that they're carried out if there's no student there with epilepsy right now.
Thank you.
Representative Terry.
Yeah, thank you. Once again, I'm trying to drill down on how this actually works. In the 5th paragraph of your written testimony, you say that you work to ensure your child would have his physician prescribe emergency medication administered in the event of a prolonged seizure. Mm-hmm. You just described as well what would happen if the event were to occur, the seizure were to occur on a school bus transporting your son to a baseball game with his baseball team. So on a day-to-day basis, would your son's medication, anti-seizure medication, have been with the school nurse?
Yes.
And then transferred to the coach of the baseball team? Or would the coach of the baseball team have anti-seizure medication as well as the school nurse? So, I mean, how many school personnel would have anti-seizure medication? Or is it just getting passed around depending on where your son is or in his backpack?
I think that level of management depends on the team, on the school, on how they're going to do it. I mean, and whether the student... my son was responsible enough to do that, and I wanted him to develop those skills to carry it with him. However, most schools during the school day want it locked up in the nurse's office. So, exactly when my son left there, if he wasn't going home after school, would he have his meds with him? So it might be that it was in the nurse's office and he got it at the end of the day and then took it with him. But that's a very individualized situation. The carrying of the meds, but having people be able to identify the seizure and know what to do is critical.
So given the wide variety of situations that may occur, as well as the types of seizures that may affect students, everything really would boil down to the plan that is developed by the parent in consultation with the primary care physician or specialist and school personnel to make sure that all situations would be covered, and that this bill would assist in ensuring that everybody was trained to some degree, depending on age appropriate and position.
Yes.
Thank you.
Representative Hall?
Thank you, Madam Chair, and thank you for taking my question. If I could ask you the question as a school board member, not as a parent of the child. The school board member, I know there's no fiscal note. Could you see, with all the trainings the teachers have to get, the teachers say, you know what, I have no problem taking this training, but we'd like you to pay us, right? You're asking us to do this on our own time, so now it becomes an unfunded mandate. Do you see that as a problem?
First, I know the Epilepsy Foundation does free trainings, but also I could also imagine it be handled similar to how I have had trainings as a educational professional through, they have this vector system where there are modules that are put in and teachers everyone's assigned which videos they have to watch and take the little test after every year. So that's just something that's already in place in districts. So we do training on bloodborne pathogens and certain things at different times, or frequencies. I would imagine that those online modules could be just phased right into the already existing for the district, and or they could have the Epilepsy Foundation do something. I mean, when it comes to a specific student, that team does need to have more knowledge about that specific student's needs. But as far as having, the bigger body of people being trained, I don't see it as being that difficult because we already do it for our EpiPens, all of that stuff.
Okay, thank you.
Representative Nato?
Thank you, Madam Chair. Been a while since I've been in school. And I know that when my kids were going to school, they were teacher conferences, they call them, or whatever. I don't know how many times a year. I know there was several times a year. I don't know if that's changed since probably district to district. Could it be incorporated somewhat to that type of meeting once a year, every other year, whatever it may be? Like, I'm all for this. I'm all for safety, obviously. But could it be incorporated into some of that being on board?
I think that would limit it to specifically students who have epilepsy diagnosed and have seizure action plans. And that is an important aspect of this. But I also think the other aspect to this is anyone can have a seizure at any time, undiagnosed. I have seen it happen. I have responded to it in a classroom for students that never had seizures before. And that's where I feel also just the broader seizure first aid identification is critical, because you have a classroom of students that are terrified. And if your teacher or whoever adults are in there do not know what to do and can't remain calm and handle the situation, then there's sort of bigger consequences of the whole thing. So I think, yes, when you have if it's students on an IEP or a 504 plan, you can certainly, for the people that are in the room, have a discussion about that child's needs. The nurses are critical. They do trainings for specific student seizure action plans to the staff that need that training. But, I think usually the parent-teacher conferences, and those conferences are around their academic progress and other things. So to take that 10 to 15 minute period and make it all about this training doesn't seem to me like it would be as useful as having trainings available to the school staff and ensuring that people are trained for the emergency management follow-up.
So you're saying you need roughly about an hour for that training?
I mean, I can't speak to, it depends on, other people have done those trainings. I think it depends on how it's implemented and what the trainings look like. What level of person you're training. School nurses definitely need a different level of training. Maybe the athletic director or trainer need a different level of training. The people who might be responding, the delegated to give the seizure rescue med and fulfill in that emergency will need a different level of training. That student's actual teacher might need a different level than everybody needing a certain amount of level of, this is what you do when somebody has a seizure, this is what a seizure looks like, here's the types of seizures so you can identify it, and to keep everybody safe, and then speak to the witnesses, the students who witnessed it, about what happened, and that person, you know, is going to be okay, and that they're just like everyone else and they can do everything else, and you can be friends with them and you don't need to be afraid. Like, those are critical things, to have the adults be able to talk to the students that witness the seizure as well, and give factual information.
Any further questions? Thank you very much. Dorothy Crowell?
Thank you. My name is Dorothy and I live in Meredith. I'm here to speak for myself, as I've lived with epilepsy since I was 4, and so for as long as I can remember. However, I've now been seizure-free for over 10 and a half years after having brain surgery in 2015. As some people have said, this bill is flexible and would we be planned around different people and what is needed for them. So I'm mainly here to share what my plan was and everything like that through school. So thanks to the advocacy of my family, I am one with epilepsy who had a more supportive and understanding community through grade school and high school. Though my seizures were uncontrolled through high school, thanks to my family's voices, my school knew what to do if I had a seizure. Starting in kindergarten, my parents always met with my teachers, the nurse, and even talked to my classmates to make sure they know what to do if I did have a seizure. In elementary school, my dad came into my classroom, read a story to my classmates, and answered any questions they had. When we were in kindergarten, the main question they were asking was if epilepsy was contagious. But by 2nd or 3rd grade, they were asking what they could do to help. They knew me enough and knew what the disorder was, and some of them had even seen me have a seizure, so they wanted to do something. By the time we were in middle and high school, they were doing things like bringing my backpack to the nurse on their way to their next class if I had gone down to fight off one of my auras, and others were doing even more. For example, part of my seizure plan was in all of the classrooms that I was in, we had a beanbag and a wheelchair. If I thought I could just fight off the seizure, I would have somebody wheel me down to the nurse in a wheelchair, whether that be one of my paras or one of my classmates. Usually I had a para in my classroom because I did have an IEP plan to help me, and the para would also carry around a walkie-talkie so that they could let the nurse know that I was coming down. However, there were some smaller classes that I would just have another student bring me down. So other people deserve situations like I had, even though some people don't have enough advocacy. If this bill had been in place, my family wouldn't have needed to advocate so much. Any questions?
Thank you very much. Any questions? Seeing none, thank you for your testimony.
Yes, thank you.
Mary
Madam
Crowell?
Chair,
Oh, sorry.
Would it be okay if we were just to say thank you for sharing that story?
Yes.
Thank you.
Right, thank you.
Mary Crowell? No.
Now it is. Thank you. My name is Mary Crowell, and I'm Dorothy's mom. I am also a retired middle school teacher, and I was a former employee with the Epilepsy Foundation, also an AmeriCorps member with them. As Dorothy said, as a parent, we trained, we made aware her community what her situation was and her health and what Dorothy needed to do. It was very helpful for us, and to this day, when we run into staff, Dorothy's been out of high school for 13 years now, and we'll run into people from the school community who won't even say hi first. It will be, how's Dorothy? And this is the custodians, the cafeteria staff. We made the awareness for everybody. Dorothy had seizures everywhere. In the hallway on the way to lunch, it delayed it for the 5th and 6th graders. They were not happy, but they knew what to do, including kids in other classes and the other staff. My favorite story was in PE class in 5th grade, student teacher from Plymouth State is being observed. And the fun activity was the parachute, where kids run underneath it. And Dorothy's underneath and has a seizure. The kids let him know right away. He got bonus points from his supervisor because he knew exactly what to do, because he had been made aware of her setup. In my role, in my 30 years as a classroom teacher in middle school, it was important to have an idea of what to expect for that student, and every student is different, so that I could best support that student in my classroom. I often, I should say always, had the students that had seizure disorders put in my class because I did know what to do. I had that background. Parents were comforted in knowing that I had the background and knowledge to help their child if or when a seizure occurred. It is so important that students with seizures know that they are a valued member of the school community and that they feel safer in their surroundings and they are not just defined by their epilepsy. It is just a part of who they are. And again, this free training, I talk about the trainings because I do them often. I've done them for 90 minutes. I've knocked them down to 30 minutes. I go in and talk to a group of 3 or 4 people who work specifically with a student so that they know what to do, and then later go in and talk to all the staff. But these are opportunities for people to best support that student. Thank you.
Thank you very much. Any questions? Yes, Representative Litchfield.
Thank you, and thank you for taking my question. In your opinion, would it be as effective if we were to do, let's say, I feel as though we're talking about 2 different topics. We're talking about preemptive, right? Or if something were to happen that was unanticipated versus a child that actually has a diagnosed seizure disorder. So that would be one thing where the school would, yes, be trained on that. But talking about just preparedness, do you think that possibly, let's say, 30 minutes every other year would be as effective as 7? Well, I'm just trying to gauge what the actual number is, because you mentioned teaching for 30 years. We expect so much from our educators these days amongst taking care of children's health, wellness, and their academics. So I'm just curious where that balance is.
I think we talk about the 60 to 75 minute training every 2 years because that's what is certified through the Epilepsy Foundation, and you can get continuing ed credits for it that all of us wanted because we need a lot. And it was just to help for that. When I did the 30-minute ones, it was more to be specific to that student at that time so that they could start the school year knowing. We went in and talked to Dorothy's classroom staff before the school year started. 1 year we missed it. The meeting was set up for the afternoon of the first day of school in 1st grade. We were too late. Dorothy had a seizure that morning.
Wow.
And they weren't ready for it yet. The nurse was. So that's what I mean when I talk about the 30 minutes. Yes, you can make it a little bit less when it's specific, but for the overall, because we talk about this as students, but staff can have seizures too, the adults. So it's important, the more awareness we can bring to everyone, I think the better it is.
Thank you.
Any further questions? Seeing none, thank you very much.
Thank you.
Parker Hod?
Thank you. I appreciate the opportunity to testify. My name is Parker Had. I'm 18 years old, and I'm a senior at Dover High School. I'm here today to ask you to support Senate Bill 433, the Seizure Safe School Bill. When I was 9 years old, my life was changed forever when I was diagnosed with epilepsy. As a third grader, when most kids worried about whose birthday party they'd be invited to, I was learning to live with seizures that could happen at any time. Hospital rooms replaced playgrounds. Everything felt hard and unfair. And instead of dreaming of playing in the NBA, I started dreaming about something simpler, just 1 week seizure-free. My seizures happened daily. Sometimes they were extremely obvious, but oftentimes they're less obvious. One of the hardest and most dangerous realities of epilepsy is that there isn't just one kind of seizure. Some seizures are obvious and dramatic, the kind people recognize immediately. Others are quiet and easy to miss. Some require medical emergency care. Others don't, but only if someone knows what they're saying and know how to respond. At school, that uncertainty was terrifying. Every day at school, I carried the fear that adults around me might not recognize a seizure or might not know how to help me. And I was worried about being seriously injured, about what would happen if I had a seizure and no one realized what was happening until it was too late. Growing up as a military child, I learned how to adapt pretty quickly. Changing schools, homes, and teachers was pretty normal for me. But the constant uncertainty of not knowing whether school staff could keep me safe during a seizure was something I was not prepared for. In 5th grade, I learned that my best chance at seizure freedom was brain surgery. In 2019, the Army relocated our family to New Hampshire so I could get the care that I needed. I started in 6th grade knowing that in January I would undergo 2 brain surgeries. While my classmates planned their first middle school dance, I worried about whether my hair would grow back and whether surgery would change who I was. At 12 years old, I had 2 invasive brain surgeries. The first surgery was an SEEG. Doctors implanted 17 electrodes into my brain to determine where my seizures were originating. And during the second surgery, they performed a craniotomy and removed a small portion of my parietal lobe and the insula to try to stop the seizures. When the seizures came back, the disappointment was crushing, but life didn't stop. I had to keep going. 2 years later, during my 8th grade year, I underwent a third surgery. Doctors performed a LIT procedure to ablate any remaining areas in my brain that were causing my seizures. Since then, I've had many challenges, but have mostly been seizure-free. I have my driver's license, I got my first job, I was inducted into the National Honor Society, and played for my school's varsity soccer team. I also just received my acceptance into the bioengineering program at the University of New Hampshire. 3 years of daily seizures, hospital stays, and surgeries, I was fortunate to have parents who never stopped advocating for me. At every school I attended, they worked tirelessly to make sure staff understood my condition, that they knew what seizures could look like and how to respond safely. And while my journey was incredibly difficult, I know many children with epilepsy face even greater challenges than I do. What this bill represents is something I didn't always have, which is the assurance that someone at school would know how to help me if something went wrong. Seizure-safe schools means teachers and staff can recognize different types of seizures. It means they know what to do, and just as importantly, what not to do. It means students like me don't have to sit in class wondering if a medical emergency would turn into a tragedy because of lack of knowledge. Epilepsy will always be a part of my life. I still take medication every day, but I've learned that progress isn't about what you lose, it's about how you rebuild. Passing the Seizure Safe School bills means fewer students will have to learn survival before learning algebra. It means parents can send their children to school knowing that they will be understood and protected. I'm asking you to pass this bill not just for students with epilepsy, but for every school that should have or be prepared when a child's life's on the line. Thank you.
Thank you very much. Any questions? Representative Woodcock?
Thank you. Thank you for being here. Appreciate your journey. When you were playing soccer, and at that time you quasi-adult, if you will, you're a high school student.
Right.
Did you carry the medication with you all the time, or was it left in school?
For me, it was normally left in school. I didn't have very many instances where I had to use emergency medication, but yeah, I never really carried it on me when I was playing soccer.
Thank you.
Follow up?
Thank you. So was your coach, I'm just trying to process right. So was your coach and assistant coach, were all those folks aware of your situation?
So my parents, luckily for me, would advocate for me, obviously. They would always talk to all of my coaches before the season had started and would let them know my condition and how to respond to something like that were to happen. So I was lucky enough for that, but I wouldn't say it was everybody on the team that was aware. I had some friends that knew that obviously I would sometimes have a seizure, but they didn't really know how to respond. But I'm thankful that my coaches were able to respond.
But you didn't carry the medicine with you when you're...
No, I did not.
Okay.
Sorry.
Thank you. Thank you, Madam Chair.
Representative Terry?
Thank you. Thank you, Parker, for your testimony. I don't want to assume too much here, but I see in your written testimony on the second page that you have initial capitalized the word Seizure Safe Schools. Is that a program or a designation or something that can be earned as a result of going through a kind of a training program by the National Epilepsy Foundation or elsewhere? Or am I reading too much into this?
I think it's a bit of a bigger question. I think Seizure Safe Schools is just more correlated to the act instead of having it be like a certification. But I'm not entirely sure. I'll have to get back to you with that question.
Okay. All right. Thanks.
Any further questions? Seeing none, thank you very much for your testimony and congratulations on your acceptance at UNH.
Thank you.
Crystal Had?
Thank you for the opportunity to testify. My name is Crystal Had. I'm Parker's mom. You just heard what epilepsy is like from the perspective of a child living through it. I want to share what it's like from the parent side because what you don't see in those moments is constant fear. When your child has epilepsy, you never fully relax. You don't send them off to school assuming they're safe like most parents do. You send them off knowing that at any moment your child could have a medical emergency, and you have to trust that the adults around them will recognize it and respond correctly. And the truth is, too often that doesn't happen, not because they don't care, but because they haven't been given the training. Parker shared a glimpse of what living with epilepsy is like, but that only scratches the surface. For several years, Parker experienced seizures daily. Like many families, we lived with the uncertainty of not knowing when the next one would happen or how severe it would be. He has needed rescue medication a few times in his life, but thankfully those moments happened when he was already in a hospital where trained professionals could respond immediately. But I think about what could have happened if those seizures occurred at school, because when a seizure reaches that point, every second matters. Rescue medications are not optional in those moments. They are critical. They are what stop a seizure from continuing, from escalating, and causing serious harm. And without training, even the most well-intentioned adult may hesitate, they may wait too long, or they may not know how to administer the medication at all. That hesitation can change everything. And what many people don't realize is that families are often left to fill that gap themselves. At every school Parker has attended, we've had to educate teachers and staff about his condition. We've had to explain what his seizures look like, what to watch for, and what to do in an emergency. We've made sure he has a seizure action plan in place so that everyone understands the protocol. But that level of preparation is not standard everywhere. It depends on the school, the staff, and too often it depends on the parent pushing for it. Safety should not depend on how much a parent knows to advocate or how much a school happens to be familiar with epilepsy. It should be consistent. Witnessing a seizure is terrifying. It never gets easier. And for someone who has never seen one before, it can be extremely traumatic. And in that moment, not knowing what to do only makes it worse. Our teachers and staff deserve better. They deserve the training and preparation so that in that moment, they are not guessing, they are ready, because in that moment, their response matters. Right now, whether someone knows what to do when a child has a seizure is left up to chance. This bill changes that. This bill is not complicated, it's not controversial, it's basic preparedness. As a parent, I can tell you nothing matters more than knowing your child will be protected when you are not there. So I'm asking you, please pass this bill for my child, for every child living with epilepsy, and for every parent who sends their child to school carrying this same fear. Thank you for the opportunity to speak.
Thank you. Any questions? It looks like you're off the hook on questions. Thank you very much for your testimony. Jennifer Pelletier.
Hello. My name is Jennifer Pelletier from Hudson, New Hampshire. Speaking about Senate Bill 433. Before expressing the importance of the legislation, I wanted to share my family's personal experience with epilepsy. My husband, my daughter, and I have epilepsy. My husband attended schools in New Hampshire and experienced multiple seizures during the day in school. So as parents living with epilepsy, we believed we were prepared to support our child navigating the education system. Our daughter began kindergarten at Hudson schools during 2024 school year. Prior to starting school, we met with the school nurse and staff and explained her medical needs and reviewed her seizure action plan with them, provided by her neurologist. From the beginning, we encountered resistance and we were told the school was equipped to meet her needs. Our daughter's diagnosis is complex. She has a rare genetic mutation called the SCN1A, which prolongs her seizures. They often progress into what's called status epilepticus, which is when a seizure lasts longer than 5 minutes and requires medication to stop it. To your example, talking about the cafeteria, in October 2024, our daughter experienced a seizure on the school playground. Staff were unsure what was happening until another child alerted the recess monitor to say that she was on the ground. The nurse was contacted via walkie-talkie and came outside carrying a Ziploc bag full of medication. It was multiple students' medication. No one was timing her seizure, so staff were unsure how long it lasted. And fortunately, the seizure stopped on its own. Rescue medication was not administered because the staff were uncertain on how to respond. The recess monitor had not been trained to recognize seizure types or to know when and how to administer rescue medication. Although the school had been provided with our daughter's seizure action plan, it was not followed due to the lack of training and support. The incident resulted in numerous meetings, phone calls, and extensive coordination with the school. Our greatest concern remains that there's only one nurse in the school, yet our daughter requires rescue medication within 3 minutes of onset. That is specific to her complex needs. Relying on a single nurse without comprehensive training is unrealistic and places both the staff and students at risk of catastrophic outcomes, including death. I hate saying that word, but it is a reality of this. We have pursued both an individual education plan and a 504 plan. However, these measures do not provide sufficient protections. As of only a few weeks ago, she was finalized to have an IEP based on other health impairments. Even when such plans are in place, schools continue to lack consistent school-wide training for all staff. The Seizure Safe Act would ensure that school personnel are prepared to respond appropriately during a seizure emergency and would significantly reduce delays in administering life-saving rescue medication. I urge you to support this bill. No child's life should be dependent on chance, confusion, and the availability of a single nurse. This legislation would establish consistent mandatory training for school staff and ensure timely access to life-saving rescue medication. Children with epilepsy deserve to attend school safely, and parents deserve confidence that the schools are prepared to respond appropriately in an emergency. Thank you. I did want to add a few things that some of the questions come up. You talked about on the playground, on the field with maybe sports and having a backpack. So what happened was when my daughter took her seizure, we had to go in and do training. So we did age-appropriate training for the students. Through the Epilepsy Foundation, they supported us. And they have a book called Maddie, and we're able to read to the kids to explain, because a lot of them were scared and concerned and confused. When they go from place to place outside of the building, if it's in the field or on a field trip or whatever it may be, her school, through my insistence, has implemented what they call the nurse's backpack. So every classroom has a nurse backpack, and it's a red backpack with the nurse logo on it. And one person is responsible for carrying that backpack to have the medication and is trained. Right now, they are only trained to carry the backpack and to monitor and learn what a seizure is. And that is because us as a family implemented that with the school district. So every person that works with my daughter does have that training right now. And that is only because of the experience we had of her in the schoolyard. And I just feel like there's such a wide array of seizures and complexity that with her genetic mutation requiring a seizure medication at 3 minutes, that we had to implement stopwatches for teachers and things like that that we provided to the school. This was something that us as a family had to stop and evaluate their plans and their routines and come up with a plan for them. And that was an extreme burden that was put on our family, which is, I feel, just another step in the epilepsy journey with families. Yep.
Are you willing to take questions?
Absolutely.
Representative Hall?
Thank you, Madam Chair, and thank you for taking my question. So I'm curious if it's not, your child is not self-contained in my classroom, because I'm doing recess duty of the whole, lots of kids out there. And I've gotten the 70 minutes of training, but I'm not really familiar specifically with your child's plan. Is that going to keep that, is that enough for your child? The 70 minutes of training. So I know the 70.
You know the basics.
Yeah.
Yeah. So you know the basics. I think one of the big pieces is her seizure action plan is very detailed. And one of the things that we started with her school was everyone has to read it, acknowledge it, and sign off on it. And so that they've read it and they understood it. They also, the teacher has a copy in her desk, so it's accessible to her if ever she needs to kind of defer to it, kind of situation. But as of right now, everyone that works with her, example, she has speech and OT in school. So the speech person and the OT person all have read the seizure action plan. They all know what is in it and what detailed, and they've also taken the epilepsy training course. And that is something that us as a family have pushed to have happen because of the experience in kindergarten that we had last year.
Follow-up, please?
Follow-up?
I'm just curious if you could define everyone. So if everyone...
So everyone that works with her, so her direct teacher, the paraprofessional, the nurse, the speech OT, there is an assigned, because of her complexity, she has a lunch monitoring form. So there is someone in the lunchroom that has completed the training, that fills out her lunch form, that kind of observes her table. As a first grader she is right now, they have a little extra supports compared to older kids. So there's a little more people in the room kind of thing.
Okay, thank you.
Any further questions? Seeing none, thank you very much. Before we continue with the next speaker, I do want to make an announcement that for the audience that no flags, props, symbols, signs are to be displayed during the hearings. Thank you. Dawn Goslin.
So I'm passing around my testimony. I was obviously uploaded it online as well, so you have it there. My name is Dawn Goslin, and I live in Pelham, New Hampshire. My daughter and I both have epilepsy. We kind of have a similar story in the beginning. Our first seizures were on the school bus. I was on the school bus on a band trip, and we went to Washington, D.C. to perform. And on our way home, we stopped at a rest area, and I fell to the ground, had my first seizure. Nobody was aware. It became kind of an emergency situation, but I'm more lucky, as I want to say. My seizures don't last 5 minutes. So they're quick. I drop to the ground, I get back up, and sometimes I drop again, maybe a couple times, but mine are due to lack of sleep or riding in the school bus. I'm photosensitive. So it's the sun between the trees causes like a strobe light effect, which caused my seizures. So I've never been on rescue meds. I've never needed them because my seizures are so short. My daughter, same thing. She was on the school bus going to school one morning. She was eating a bagel for breakfast. And in Pelham, the high schoolers and the middle schoolers ride on the bus together to get to school and go home. And I was fortunate that my son was on the bus because he was in high school at the time. And he recognized, due to family history, they thought the paramedics thought she was choking. They called the paramedics right away. I showed up. There were 2 fire trucks, an ambulance, and multiple police cars there. And they thought she was choking. And my son, he was like, she's not choking. She's actually having a seizure. So knowing that situation, and I'm glad every day that my son was on the bus with her. That day was actually bus evacuation drill day, and didn't become a drill. It became a real life thing where, thank God, the bus was close to the school. They evacuated all the students off the bus, and they were able to get to school because it was literally like 10 steps from the school that this all happened, in which I met down and picked her up, and I ended up, she had come out of her seizure. She didn't need rescue meds. I ended up taking her just as precautionary to the hospital, and everything ended up working out fine. But shortly after, that's when she was diagnosed with epilepsy, because we kind of knew. In 8th grade, she became part of, it's called Teen Speak Up. Ever since she was diagnosed, she became a big advocate for epilepsy and her situation, how to fix it, how it can help. And so we went to Washington, D.C. and met with the local state representatives to kind of advocate and say our stories and help with the Epilepsy Foundation. So it was a great opportunity. And when she got back, her social studies teacher actually gave her the opportunity to inform the class of what she did while she was in Washington, D.C. and how students in her grade could help if something ever happened. Now, when I go back to the bus, there were other people, her peers, that were sitting next to her on the bus and were panicked because they couldn't help her and they didn't know what was going on, understandably so. Those students, as she got older, continued on and got education to help her in case it ever happened again. Me and my daughter also participated in many school activities, and I think this might answer some of your questions. My daughter participated in band, drama. She was on various honor societies. She participated in cheerleading, swim, indoor and outdoor track. She was at the school from usually 6:30 in the morning till 9:30 at night. And the principal actually told her one day, I think you're here more in a day than I am as a principal, which was true. So she didn't also just attend Pelham High School. She also attended Pinkerton Academy in Derry, New Hampshire, where she received her license in a nurse's assistant. Now she's off on college, and she's going to be a nurse, and she plans to attend, she wants to be part of the neurology field to help others that are in her similar situation. So she couldn't be here today. She is clinical from 7 in the morning till 7 at night. Not much has changed with her. But being in different schools, going different time frames of different activities, and I wish Representative Tenzar was here today because he is actually was my daughter's swim coach in high school, and he still is currently the swim coach there now. So he would have loved to have been here. I was with him last week and we were talking about it. So it's nice to have that support wherever you go. I know there's a lot of times in this, the nurse at Pelham High is a part-time nurse. They're floaters. They go from one school to the next school to the next school within Pelham, but they're not always there. My daughter's seizure medication was locked up in the nurse's office, and that was the protocol. It had to be locked up. The student can carry it around, but after school, she had a different backpack that she would do her various sports, swim, because she needed uniforms and all that stuff. So between cheer, indoor and outdoor track, riding buses, the swim was at a workout club. It wasn't at the school. So she was able to carry her rescue medication with her in her other backpack for after school activities. Plus, to kick this off, I also took all the pictures for all the various sports. So they would have a meet, or they would have a game, or they would have a competition. I would follow them around from game to game or meet to meet, and I would have her rescue meds in my camera bag with me at all times. So it's not that the kids don't want to learn. They want to learn because they'd rather know what to do than be caught in an emergency where they can't help. Same with teachers. I've had teachers come up to me and say, I saw that I had your daughter as a student this year. I just really wanted to be prepared, so I went for seizure first aid training. Didn't ask them to. That's just what they did because they'd rather be prepared than come into an emergency and not be prepared. Same thing while my daughter was at high school. We saw that the Epilepsy Foundation was having a seizure first aid for teachers and administration. I sent it to the athletic director because, again, my main concern now is not just in school, but after school because she's there for so many hours. They offered to take it, and they said, well, we're going on school break. Nothing better than perfect time during school break. We have a lot of free time. We're going to look into taking this seizure first aid and get certified to be prepared because she was in so many avenues of different areas. Passing this seizure first aid, Safe School Act would be beneficial, obviously, because not always just the nurse that is floating and not always at the school, but multiple avenues of teachers or staff to learn how to prepare for a seizure in case it does happen.
Thank you very much. Any questions? Yes, Representative Dry.
Thank you very much. Thank you for taking my question. Can you tell me about the training? Is it done by specific trainers? Is it something you do online? How often do you have to renew?
It was done online. Epilepsy Foundation provides different timeframes, or if they have a group of teachers that want to learn, they'll create a first aid specifically for the school district. But I took mine online, and my family did as well. They're all seizure first aid certified, and then after the 2 years, we just recertify. It's a quick process. Just because you know the information by then, you're just recertifying with the same information to be prepared with your renewal.
Yes, follow up.
So just what I'm hearing, there are different kinds of medications that people take. Does it cover all of those branches, or do you need to be specifically attuned to the student that you be working with?
The medications advance all the time. In the beginning, my daughter, when she was diagnosed, it was inserted. It's a gel through the rectum. Obviously, when you're going into high school, you're like, I don't want to be in the scene where that's going to happen. So they've advanced medications along the way, and now she has a nasal inhaler. It's just it goes in your nose, each nostril, and it's really quick. And that's usually not given until the person's greater than 5 minutes with a seizure.
Any other? Yes, Representative Nato?
Just a quick one. Thank you for your testimony. And in case I missed it, is it a live training or are there videos you can go back and look at it again if you missed something?
There's live and then there's virtual. It's just, it's really quicker than you think. You're just going through scenarios of what would happen, how to do first aid, and move forward from that as to if it's greater than 5 minutes and if you would want to call the paramedics if needed. If you have the rescue med, you can use the rescue med until the paramedics get there. It's pretty straightforward.
Any further questions? Seeing none, thank you very much.
Thank you.
And last but not least, Becky Wilson, unless there's somebody else with a pink card out there who hasn't submitted it.
Thank you very much, Madam Chair, members of the committee. For the record, my name is Becky Wilson. I'm the Director of Governmental Relations for the New Hampshire School Boards Association. We're not taking a position on this bill, however, and we certainly appreciate the intent of this bill. Having one of my own 4 children with some significant complex medical needs throughout his school career, which led to multiple medical emergencies, I certainly can identify with the people behind me who have testified and about some of these concerns that are being expressed and how scary it can be to send your child off to school when you have no idea what the day brings ever. So I certainly can understand that. It is unclear to us, though, in what school settings currently in the state or in what situation where we have a child who has a known seizure disorder is not being provided with some sort of school health care plan or a 504 plan or some other written documentation that outlines who is trained in what and when they need to be trained, what the approach is, as you've heard, if a child is to experience a seizure at school or at a school event. Any school in the state that accepts federal money is required to follow Section 504. I can't off the top of my head think of any situations where a child with a known seizure disorder would not qualify for a 504 plan, although maybe there are some situations. But unless the child is attending a school that does not accept any federal monies, some private schools don't accept those funds, so therefore they wouldn't be required in a private school to follow that. However, I think unless there are particular issues around that, it's difficult for me to imagine a situation where this wouldn't be able to be addressed through a 504 plan or a school care plan or a health plan. It is confusing a little bit when we look at the bill. The language seems to be addressing only students that are currently identified or already known to have a seizure disorder. But then as I've been listening to the testimony, it seems like it might be an expectation that it is beyond that to any students that might have a seizure unexpectedly or staff. We have had multiple bills, as you know, over the last several sessions about things like AED devices, requiring first aid training for staff that are available at after school or before school events or off-campus events that are sponsored by the school district. So I think we would ask that this somehow be clarified if this bill is moving forward about whether this applies only to students who have a current written diagnosis of a medical condition that involves seizures, or whether this is more broad, as we've talked about in other situations where we are trying to anticipate what the response is going to be if somebody has a seizure that is unexpected. For most unexpected emergencies, as you know, school staff are going to administer first aid as appropriate and then call 911 and then call the parent. I mean, that's primarily what we do in those situations. And again, the health plans that most people have already talked about as well are fairly detailed in terms of how long to wait, what to do, what administration of medication is required, when you give it, et cetera. When you call 911, how long do you wait until you call 911? The language in this bill is confusing. If it says by 26 and 27 that you're required to have 2 staff trained, however, it says one of which shall be a full-time school nurse. That is concerning to us. I'm concerned about the comments that were made by the sponsor that that would mean an athletic trainer or a school nurse would need to be available at all times in every school-sponsored situation. I don't think that that's currently the case across the state. for no other reason, maybe just in terms of availability of school nurses. I think you've heard over the last couple of sessions, trying to find school nurses has become critically difficult across the state. You have all passed multiple bills to try to make that easier, but it doesn't create a bigger pool of people. So if this bill is requiring that a full-time school nurse be available across the board for every school-sponsored event, I think that is concerning. As well as the fact that there is currently legislation that's trying to remove the school nurse as mandatory under the Adequate Ed statute, House Bill 1121. This bill has already passed the House with the school nurse removed from the content of an adequate education statute. I think some of you here might have voted for that bill. It's already had its hearing in the Senate committee, and the school nurse is still removed from House Bill 1121. So line 25 of this bill on the first page seems to really conflict with that. Is this a mandate that the school nurse, we need to have a full-time school nurse in every single building all of the time for every school-sponsored event? In order to implement this bill, that the presence of a full-time nurse shall serve as one of the school employees does not really sound optional. So that's a question that we would have about this bill. Lastly, I think you've heard a lot about the medications and things like that, and sort of the ways in which these are administered. Again, I think that we are dancing a line over the last couple of sessions around, protecting students' privacy, protecting children's dignity. Where does this fall in terms of training of other students? How many staff are getting trained in students' personal information? I appreciate the fact that most of the families behind me seem very comfortable expressing and sharing a lot of this information with everybody that is willing to listen about their child, but not every family has expressed that over the last couple of years in these committee meetings. So I just don't know, where is the line? We have volunteers, substitutes, field trip monitors, bus monitors, lunchroom staff, some people that might see these children for 5 minutes a day or in the hallway. Are we being sensitive to ensuring that there's understanding, but also not oversharing of students' personal, private medical information with a broad group of people? To make some suggestions, I guess, if people want to support this bill, first, I would strongly suggest the committee address the role of the school nurse. Is it optional? Is it not? It shouldn't be a local nicety based on whether or not a local community can afford a school nurse or find a school nurse or pay better than the district next door so they get one and you don't. I would certainly address that first. Also, would there be a way to instead use this bill to ensure that students with a known seizure disorder or a medical need that experiences seizures could ensure that they have a 504 plan or a care plan in place prior to the start of each school year, that the care plan would identify certain things such as who needs to be trained prior to the start of the school year, what trainings they need to have, that their appropriate prescriptions are updated and in the school nurse's office, and who has access to them and how to get to them. What are you doing for field trips or off-campus experiences or after school or before school? Who needs to be, could we just make sure that those pieces are somehow captured in the school health plan for that student? And who is required to do certain things if the school nurse is for some reason unavailable? There are several policies already that the school board has around school health plans, Section 504, emergency care, first aid, student health services, school nurses. And the Department of Ed rules around school nurses also allows school nurses to designate somebody in their absence to do certain things. That I think also could be identified in the student's plan in terms of who the school nurse is designating or delegating certain roles to in an emergency. I'm happy to try to take any questions.
Representative Freeman.
Thank you, Madam Chair. Good morning. Thank you for taking my
Representative Freeman.
question. I want to thank you for bringing up the 504 issue, and the question I have for you is, can you think of any reason why a 504 would not be issued for a medically documented case of epilepsy? Because I can't seem to come up with any reason. I thought that's exactly why the 504s were developed. Can you shed any light on that?
Thank you for the question, Representative Freeman. I do think a 504 plan lays out reasonable accommodations that I'll just say a child, but a child in this situation would require in order to access their education. There could be situations where a child had a seizure disorder that did not require accommodations, but also might require a health plan, a response plan, in which case, in my experience, the child would still have a written care plan that is filed with the school nurse. It would not be a 504 plan because perhaps they don't need accommodations, so to speak, but they would still have a documented care plan that would be held at the nurse's office that would require designation of all of these things.
Thank you.
You're welcome.
Representative Hall.
Thank you, Madam Chair, and thank you for taking my question. You brought up the idea of substitutes. Are they going to be mandated to take this training the way this is written?
Thank you for the question, Representative Hall. My interpretation of this would be similar to the other trainings that we require of staff. So yes, I think, bloodborne pathogens, suicide prevention training, getting your background check, all those things that apply to substitutes now, if this were to pass, then yes, I think they would also be required as school staff, so to speak, to be able to have to show that they've had this training.
Okay, thank you.
Representative Litchfield.
Thank you, Madam Chair. Thank you for taking my question. I'm looking specifically page 2 on line 16. And I just want to make sure that there aren't any unintended consequences or that I'm understanding this correctly. But it states here, the school shall store the medication under paragraph 3 of this section in a safe and secure location, accessible only by school personnel or volunteers with training to administer seizure medication. Does that mean that the student would never be able to carry their meds during the school day?
Thank you for the question, Representative Litchfield. This is fairly standard language for prescription medication that is used similar to EpiPens and things like that we've talked about in the past. I think that in certain situations, depending on the age of the child or whatever is happening, again, that would be outlined in the care plan or the 504 plan in terms of what medication the child is able to have on them. Typically, the prescription from the medical provider would state whether or not the child can carry that with them or not, or whether or not a staff, for example, needs to have some sort of pack that I think you heard about earlier that goes with the staff that is responsible for making sure that medication is close by. I don't think it would completely eliminate it. I just think that for the most part, this medication needs to be stored in a place where it's not accessible to just any student or any staff member other than the person that it is prescribed to.
Representative McDonald.
Thank you, Madam Chair. Thank you, Ms. Wilson. If a student were to have a seizure and they do not have a documented history, perhaps they don't have a seizure disorder, it's their first time, would they not have a 504 plan because there's no medical need? And would this help in that case?
Thank you for the question, Representative McDonald. I think that situation you're describing would be handled like any other medical emergency in a school for a student or staff, quite honestly, that you're not aware of any kind of health problem, which is, again, I think it's all melding together now, but whether it was last session or the session before, you had passed some bills about making sure that there were certain first aid trained people available in the building or for after school events and things like that. Those people would administer first aid, in my understanding, the same way they would for any person, whether, other than a person who has a very specific care plan. They would administer the first aid, they would call 911, and then if it was a student, they would call the parent next, I think, to address that situation. There's no people without a known disability certainly would not have a 504 plan because it would not be known.
Representative Drag.
Thank you, Madam Chair. Thank you for taking my question. How many full-time nurses are there, like percentage of that versus the half-time, part-time?
That's a great question, Representative Dry. I don't know off the top of my head how many licensed school nurses there are in the state versus how many are currently in a full-time position in a school district versus how many school districts are contracting for school nurse services through a nursing company versus who has a full-time school nurse that travels between schools in a district. I can't answer that. We do have some students, obviously, with significant medical needs, some of whom have their own LNA, some that is assigned specifically to a student, some who have their own nurse honestly, who are assigned to an individual student based on their medical needs. So I think it's really, I can't answer that question. The School Nurse Association may be able to give you a better answer for that.
That's a good idea. Thank you.
You're welcome.
Representative Woodcock.
Hey, Madam Chair. Good morning still.
10 more minutes.
This is our 10 o'clock hearing. A couple questions. You're talking about the volunteers, from Representative Hall's question about volunteers. Those aren't, most of those people in subs aren't under CBAs, I would think. So wouldn't that be a cost then to bring in subs? Not that I'm suggesting they shouldn't, but bring in subs to the school district, because there's no financial note here. They said it was free because of the Epilepsy Foundation, but if you're bringing people into work for a day, have to be there, in addition to all the other trainings we have, wouldn't that be an additional cost for the school district?
Thank you for the question, Representative Woodcock. I would imagine that in theory, people are imagining this bill like you did for others, like the suicide prevention, like for background checks, et cetera, which would require your designated volunteers to go through a certain amount of training or a certain, check off certain boxes before they're allowed to volunteer. I would imagine this would be one of them. So yes, it would be another 75, 90 minutes in which those people are either giving of their time or the district is required to compensate them somehow for taking this training.
Follow-up or
Yes.
clarification?
Absolutely. Ms. Wilson, so this has 60 days after passage as a time frame. Based on the stuff the school board policy, school board association does, is that even possible?
Thank you for the question, Representative Woodcock. I would have to go through the bill more closely to look at what the timelines are that are required in it. Even though the bill might pass in 60 days, I don't think it requires everybody to be trained within the 60 immediately, but it does require the 2 school employees, one of which, the way I interpret it, must be a full-time school nurse. It does require that by the start of this coming school year.
Right.
That could be a challenge, particularly if you have districts who do not currently have a full-time school nurse. You're talking about budgeting for a position when your budget's already completed or trying to figure out how to meet that aspect of this bill. And then certainly I would imagine that by the fall, the expectation would be that all of your staff would be trained before the start of the school year, which again, it's not to discredit any of the trainings that people bring before this committee and many others. They're all important to someone, and we certainly don't want to minimize people's needs or children's safety. However, there are every year more trainings that are being put on. I think I heard Senator Lang say, everybody gets 185 days, so what's, one more 75-minute training? Well, okay in isolation, but when you're looking at the big picture, those days are there for a reason. They were there before we added all the trainings in the first place. So that teachers could do professional development to be good teachers, not necessarily to walk this line of also providing, some of these other things that are equally important, but we're not adding time to teachers' contracts in order to accomplish this. We're taking time from other things.
One clarification, if I may, Mr. Chair, from something she said before.
One clarification, Representative.
Absolutely.
Just to clarify the clarification.
Yes, there's something you mentioned before. We were talking before about the adequacy.
Yes.
And as many people around us voted to take school nurses out of adequacy.
Yes.
Now that we have a bill that requires school nurses, and a bill we know we have many very poor school districts. How is this going to happen when a school district can't afford a school nurse and doesn't get adequacy work?
Thank you for the question, Representative Woodcock. That was my point earlier, is I don't know how this becomes a local nicety, so to speak, that if you can afford it or find somebody that wants to do it. I mean, again, I think the weight on school nurses at this point, with also like what they're carrying in terms of the role and all of the things that fall under that, is very heavy. It's a lot that we're asking. And if you can't find somebody, if you can't afford someone, if you're using a contracted agency, I don't know to what extent you can, manipulate your contract with an outside agency to ensure that all of these things are happening. Some schools just don't have it. If it's not required, they have to cut from somewhere.
Okay, thank you. Thank you, Madam Chair, for the clarification privilege.
Anytime, Representative Woodcock. Any further questions? Seeing none?
Thank you.
Thank you very much. Are there any more pink cards on Senate Bill 433? Seeing none, I close. Oh, yes.
Thank you. I wrote it down earlier, and it came to me now as you're sitting in the chair, unfortunately. I'm asking, is it possible for you to ask the researcher to provide the committee a list of trainings that just during this 2-year session that's gone through here that we required?
A list of trainings that we have passed?
Yeah, so we can see how many hours we're actually talking.
We have that list available, it seems.
Perfect. If it could be
All right.
distributed, that'd be great. Thank you. Thank you, Madam Chair.
Thank you very much. And with that, I close the hearing on Senate Bill 433.
You're only a little over.
We will take a 5-minute recess before beginning the next hearing. We need to swap out clerks and chairs, and if any committee members should know that they can take a break at any time they want during a hearing.
We'll open the hearing on Senate Bill 430 relative to mandatory disclosure by school district employees to parents and legal guardians. And I recognize the prime sponsor, Senator Lang.
Thank you, Madam Chair. I am Senator Tim Lang, and I thank the committee for having Tim Lang Education Policy and Administration Day here in the state in Granite Place. This might be a little bit of a deja vu. We passed this bill last year. The outcome, though, didn't end up rosy because on the House floor, I apologize, they added 3 floor amendments to it, one of which created a financial penalty, which the Senate refused to agree with, and the House refused to remove it. So we ended up in a non-concurrent situation, and the bill died. So we're back at it today with a same, a little bit different bill. The only difference in this bill, as compared to what you had last year, was Section 3, which creates some rulemaking authority for the Department of Education. But I'll quickly run through the bill for the people that weren't here last year. In Section 1, it's pretty straightforward. This is a process bill. This is to create a uniform process statewide for how parents and teachers will be engaged with each other and have communications with each other. So in Section 1, the Senate did amend this and added the language "and legal guardians," because nowadays we have a lot more people who have custody of children that aren't necessarily the parents. The first one is really simple. When a parent or legal guardian submits a written request to a teacher about information, within 10 days, the teacher must answer in an honest and complete manner. There's been some conversation about completely and honestly, and what does that mean? And I'm pretty sure people with a bachelor's degree, a PhD degree, can figure out what honestly and completely mean without having to have a spoon-fed definition to them. The second part, we do recognize that some information may create a hardship for a child. And so we create an escape clause in our in Roman numeral number 2. And it says that if the credential holder in answering the question feels that it will put the imminent risk of physical harm, abuse, neglect, that credential holder is entitled to withhold that information. But I would postulate that a child who a teacher thinks is at risk is at risk. Right? That risk exists because that parent can find out that information in any way, shape, or form, and that child would still be at risk. So again, if a teacher or credential holder, I should say, thinks that the child is at risk, they file the appropriate paperwork with Department of Human Services saying this child's at risk for disclosure, for abuse because of disclosure of this information or their situation. Again, my argument would be, again, that risk exists whether the teacher tells or not. And the parent could find out any other way, in which case that child is still at risk, so the teacher should disclose. Again, Section 3 is about rulemaking, and Section 4 is where we had some disconnect between the House and the Senate in the violation. We want to make it just a violation of the ethics, and an investigation will occur and find out if they violated the code of ethics, and then they can make the appropriate determinations for what penalties may or may not exist, or find out that didn't violate the code of ethics. It didn't occur, and they're able to do that. So this is a process bill. They're going to hear a lot of testimony about a lot of other topics, but in the end, this is a straight process bill. When a parent asks a question of the school, they should get an answer in a reasonable amount of time, and the answer should be honest and truthful. Anybody who's arguing they vote against this bill is arguing against that concept, that parents don't deserve a timely answer and they don't deserve to be told completely and honestly what's going on. And I'm happy to take questions.
Okay, are there any questions? Representative Balboni?
Thank you, Madam Chair, and thank you for taking my question. Last year, we passed the Parental Bill of Rights, 189B4, and listed on Section E, one of the rights is to inquire of the school or school personnel and promptly receive accurate, truthful, and complete disclosure regarding any and all matters related to their minor child, unless an immediate answer cannot be provided when the initial request is made, in which case the answer shall be provided no later than 10 business days after the request. This is already in law. Why do we need this?
Great, thank you. There's no escape clause in that language at all, is there? So if it is going to put a child at risk and the teacher believes it's going to put a child at risk, there's not an escape clause in there, in that what you just read me. This would provide an escape clause for educators, for credential holders. Let me be clear. I keep saying educators, it's credential holders.
Any other questions? Representative Cornell?
I don't know what written inquiries, can it be just a blank written inquiry, or does it have to be a specific, like as a guidance counselor, a parent would write to me and say, has my child been coming to talk to you about anything at all? And I have to answer them, yes, they have been talking to me about, or do they have to ask me specifically, are they telling you, what are they telling you about what's going on at home?
Thank you. So let me answer that question this way. So I have 4 children. I have 2 girls, 2 boys, and a girl, boy. In my relationship with each one of those children, there's been points in time where I have a phenomenal relationship with my children, and they tell me things I wish they didn't tell me. And then I have other parts of our relationship where that's not so much true, that there's a disconnect for whatever reason. If we're in that ebb and flow, when we're in the ebb side, where the relationship may not be that great, but I recognize something is going on with my child, that something is happening. I don't know what it is. I've asked and I get, everything okay? It's fine. Anything going on? No. And I get the one-word answers from your teenage child that you sometimes get. But I know as a parent something's happening. Who is the next most likely person to know what's going on in that child's life besides the parents? And according to everybody, the next most trusted person is the teacher. So why is it not reasonable to have a parent go and ask a question like that? I recognize something's going on with my child. Are you aware of anything that's happening? Right? That's mental health, right? That's what we're talking about, is providing good mental health services, having parents who recognize there might be something going on with their child, asking that next most trusted adult, and hopefully getting an honest and complete answer into the relationship. And I don't know what that answer could be. I have no idea, because every situation has a million different variables to it. But that basic concept, should a parent be able to ask the next most trusted person in a child's life, is there something going on that, because I recognize something's happening with my child? And to think that we would not tell the truth on that, to me, is a bad precedent.
Representative Woodcock?
Thank you, Madam Chair. Good afternoon. I'd like to go to line 13, if I may, and go to the conjunction. And when you were talking about the escape clause, and I'm reading that, and may withhold only information that creates the risk. Is that withhold that information from the parent, or withhold that from DHHS? Or from whom? I know it's in a it's in a DHHS section 2. Yeah. But is it talking, and we have the comment in the end specifically about that, or that is the escape clause you're talking about? They may withhold the information that creates the risk.
So thank you for the question. So again, if you read the section in whole, right, the first part of the section, it says, again, if in a good faith determination, such a complete and honest response to the request would put a student at imminent risk, right? That's what we're talking about. That's the information, right? So withhold the information is from the parent because it's creating a risk. Okay. So, but you would have to disclose, because you have to disclose what is your basis for determination of an imminent risk, and it would be, this is the information, and this is what I've been told, believe. The child said that if you tell my parents this, they're going to kill me, right? And if the teacher believes that is a credible threat, they have an obligation to report, and they should report that. And so it's a combination of what are you withholding and what's the risk that creates. That's if told what it creates. So you would have to disclose to DHHS both the information and that's creating the risk, and then the risk itself.
Well, Madam Chair. So I remember when you opened about talking about people with BSs and PhDs and those things, that they can understand what's reasonable. So someone who has an education and understanding of youngsters, they could create, they're determining, as you said, what's reasonable. So if they believe it's reasonable to withhold that information, that would be the escape clause, right?
As long as they did the reporting that's required.
Well, they wouldn't have, based on, okay, question, just, that's all. Based on that, that's why I asked you before if that was just DHHS, because they wouldn't have to report it because it says they can withhold the information, that's all.
So again, the issue, again, Representative, read it and hold on line 12. The credential holder shall file a report. So it's a shall. They have to file a report. The withhold information is from the parent. That creates the risk.
So that's the parent. Okay, thank you. That was asked initially. Thank you.
Any other questions? Representative Hall? Thank you, Madam Chairman, thank you for taking my question. Do you believe that students have any rights at all in these type of situations? Do students have rights?
I think students have limited rights. Right? So again, I go back to a situation, we'll use mental health because it's probably the thing that's going to cause the most conversation. If a child is going to harm themselves, they're not going to do it at school. They're going to do it at home, right? And so if you withhold information due to a right of the child that results in the child going home and harming themselves, and you knew that the child was struggling through something, and the parent then asked you a question, the parent can't be on the lookout for the problem that might be occurring at home beyond the fact that I'm getting one-word answers from my child, right? They may put a little more scrutiny on the child to make sure that if they're struggling through something because the teacher told them, they can watch that child and make sure the child doesn't hurt themselves, right? But if you don't tell the parent can't watch for the signs of self-harm.
Thank you.
Any other questions?
Representative Perona.
Yes, thank you very much. As sort of a follow-up, so students have a right to be safe from abuse. So the way that I'm reading it is that if the credential holder reports to DCYF that they think the child might be at risk of abuse, then that is making sure that the right of the student is upheld.
Absolutely
Am I
right.
reading that correctly?
Absolutely.
Representative Balboni?
Thank you, Madam Chair, and thank you for taking my question. Last year, we also passed a bill related to amending the Teacher's Code of Ethics that included a responsibilities to parents section. So isn't this rather jumping the gun? Because the way where this is placed in the law is placed in the section that's pertaining to dismissal of teachers. I mean, that's the segment that you put it in. So it's clear you referred to this as an escape clause, but it actually is in a section that is talking about dismissal of teachers. And that would be the 189 section 189. So isn't
I'm sorry,
it
can you
pretty
tell me
much
where in my bill I'm going to 189? In my bill?
in your bill, the section is placed, amend RSA 189, by inserting after section 13C, the following new section. So that 189.13 is the section pertaining to dismissal of teachers.
189.13D deals with communications between teachers, parents, and legal guardians. That's what that section is titled. I don't know about dismissal, but this is a new section that's created, and it doesn't necessarily relate to the one above it, other than the code of ethics components that may be required under dismissal. I haven't read that section. This is a brand new section of law that is relative to communications between teachers, parents, and legal guardians.
I just follow up, please. So again, we already have in place that there is rulemaking going on, I assume, pertaining to violations of the code of conduct relating to parents. And these parents' rules have not yet been established. It seems to me that would be jumping the gun in terms of putting this in, and I do not really see this as an escape clause.
I don't think there was a question there, it was a statement, but okay.
Any other questions? Oh, Representative Freeman?
Thank you, Madam Chair, and it's so nice to see you again, Senator Lang. It's been a long time.
Last night, school board meeting.
Based on this bill, and if a student is being abused by a girlfriend or a boyfriend, and a parent inquires to a credential holder, and the credential holder is aware of that situation, would this law apply to that scenario?
So I think this law would apply, but again, I think there's also the basic mandatory reporter for abuse would also apply, right? So they already have an obligation to report.
Follow-up?
would you agree that the mandatory reporting has to be to HHS, but this bill would allow that information to also be conveyed to the parent?
Yes, I guess in a short answer, yes.
Any other questions? Seeing none, thank you very much.
Madam Chair, you think you're gonna take a break because I have to go to a caucus meeting from 12:30 to 1:30. So I'm trying to decide what my time looks like here.
So we're gonna take some testimony. We will take a break at 12:30, come back at 1:15, finish this up, and then get the other one started.
Thank you.
Is there anybody, before we take testimony, is there anyone that can't be here until 1:15?
4:34.
Okay. And we will do, we will time the testimony at 3 minutes. And Amy, I'm gonna mess this up. Teravecchi?
Maybe we're running out of schedule based on his.
No one can pronounce it, so don't worry. Amy Teravecchia with 603 Equality. Thank you. So my opinion today, I'm speaking in opposition to this bill. My opinion today is informed both by my experience as an advocate and also as a mother. I have several concerns with the bill, which I hope to lay out for you. Educators and educational institutions should not be a pathway for parents to understand a piece of their child's personal identity. It creates a concerning and dangerous precedent, placing public schools in a role of surveillance. Schools should be a place of learning, an environment for studying both curriculum and a place of critical self-examination. Placing educators into a role of monitoring and reporting removes the trust necessary for a thriving academic environment. And of course, educators are also already mandatory reporters. So if there is a risk to the child's well-being, they have to report that to DHHS. SB 430, if signed, would also be detrimental to building trust between child and parent. It removes the opportunity for parents and children to build trust within their own relationship by having an open and honest conversation. And there's been ample research that shows that children who have big or difficult news to share with parents tend to have better long-term outcomes when provided with opportunities to share that information with them directly and on their own timeline. And although SB 430 references RSA 169C30 in order to grant protections and safety to children at the center of these requests, risks inside the home are really difficult to ascertain for educators. So it puts at odds the threat of investigation and punishment that an educator may face for failing to comply. And it, again, puts educators in a role of detective. The public school system into a role of surveillance in order to properly enforce SB 430. This means educators have to monitor not only student behavior, but also parental behavior and beliefs. And the procedure outlined in the bill creates a dangerous roadmap for those working within the school system that will jeopardize the well-being of students and children, create uncertainty, and inspire a culture of surveillance. For all these reasons, I urge you to recommend SB 430 ITL.
Thank you. Are there any questions? Seeing none, thank you very much. Don Wells?
Mr. Mills indicated that he needed to leave, and I urged him to submit written testimony to the chair.
Okay. Jay Hawkins? I think that's it.
Thank you to the committee for hearing me today. You're read to all day. I'm just going to speak to you as a human. I'm Jay Hawkins. I live in Concord. I've had the retaliatory side of this ban happen to me. When I was in middle school, I was bullied by a teacher and a student. That teacher got in trouble for that, had a conference with the other teachers in my grade as well as my parents. In retaliation, that teacher told my parents that I was gay. Had I ever told anyone that? No. Did I know that to be true yet? No. He was angry and wanted me to get punished too. That retaliation responded with me having my teeth broken by a family member and being put in conversion therapy. I wouldn't wish that on any human on the planet. It's one of the worst things I've ever been through. I spent a year of my life wanting to die for something I didn't even know was true. It took years to get to the point that I felt okay being a human being that was alive. I understand that there are a lot of things that parents need to know. But that's not always the case. When it comes to gender, when it comes to sexuality, there's some things people aren't ready to say yet or may not even know to be true about themselves. Please don't torment people for information they're not ready to give. If it's an abuse situation, that's a different ballgame. If it's a bullying situation, that's a different ballgame. But I didn't get to know who I was told who I was. And I was tormented for a year. I went to a therapist 3 times a week, and they tortured me for a year to make me be straight, and it didn't work. Please don't do this to other people. That's all I ask. Please don't do this to other people. There are exceptions, sure. They don't want to be my side of the exception. That's all I have.
Do you want to take questions?
Sure.
Are there any questions? Seeing none, thank you very much. Nancy Brennan?
Good afternoon. Thank you. We've heard a couple of hard stories, one from the prime sponsor of what could happen, and one from the victim of bills like this. I'm a retired teacher. I'm a parent. Used to be a school board member. So I've seen this from a lot of angles. And I would like to suggest, as I did last year and as several other people did, what happens one level below that there's an abuse at home, or my child might be trying to kill themselves. What happens when a kid comes to a teacher, as kids do, and I taught middle school and high school, and kids come and they say, Mrs. Brennan, my parents they're going to get divorced. I don't know what to do. And they break down in my classroom, and then they say, but don't tell my parents that I told you. They said, don't tell anybody, and I just don't know what to do. And so you comfort that child and you ask, is there somebody you can talk to? Have you got an uncle, a grandfather, etc. And I had it happen with gay kids. I don't know. I want to tell my parents, but I don't dare. Should I wait till I go to college? And so as a teacher who cares about kids, we listen. And I had a particular kid. And I said, you don't feel like you can talk to your father. Can you talk to your mother? Well, maybe. And I said, why don't you think about that? Talk to your mother and see what she says. And the kid did, and it worked out. I mean, the father wasn't great about it, but the mother said, oh, honey, I've known since you were 10. And so the kid was able to come back. But what if that father had called me before the kid got a chance to get himself together? I mean, am I a bad teacher when all I'm doing is listening to a kid who needs a listener? I really think you need to look at the situations like the one we just heard, but also down the line, if that makes sense. Thank you.
Thank you. Are there any questions? Representative Balboni?
Thank you, Madam Chair, and thank you for taking my question. As you were saying that, I thought of another instance where it doesn't state in the bill, it says either parent could ask. I mean, could there be instances where a child is put in a position where the two parents, as you pointed out, might be divorcing or have differences in opinion, and yet the way I read the bill, if either one of those parents come and ask for the honest and truthful answer, that school teacher or a professional would have to give an answer. Is that the way you also read this bill?
Yes, absolutely. In fact, we had a situation at our high school where a parent said their child could not date. I mean, we know what the kid told other kids. She'd talk about it because everybody was going to the dance and she couldn't go. She wasn't allowed to date. And we knew there was a kid at school that they liked each other, but we didn't call and ask. Nobody asked us. One day, the father showed up, and the kids happened to be standing outside one of their cars holding hands and talking, and the father ran up and decked that boy and then yelled at the teachers, you should have known my daughter's not. Now, he hadn't told us, call me if my 17-year-old holds anybody's hand. But, now that might be one that you had to talk to HHS about. I certainly would hesitate on some of the kids I talked to. I wouldn't call HHS over a father who might be upset that his kid was gay. I mean, I'm not going to call HHS over that. The other father I might have called on had I known the situation. And by the way, and I don't know if this is coincidental because very often these bills, have letters, but if you look at this bill, HATE are the first letters of the subdescription, and maybe that's just a coincidence. I don't know, but it doesn't feel helpful. Maybe it's a coincidence.
Any other questions? Seeing none, thank you very much.
Thank you.
And we will take a break until 1:15.
I will reopen the hearing on Senate Bill 430 relative to mandatory disclosure by school district employees to parents and legal guardians, and I call on David Trumbull.
Good afternoon, Madam Chairwoman and committee members. My name is David Trumbull from Ware, and I oppose this bill for two reasons. The first is that I think it will damage family relationships between parents and children. The bill requires that a school shall file a 169C petition if they believe
Can I
there's-
just ask you to pause really quick for 1 second? I forgot to announce that we have a 3-minute time limit on each person testifying. I took on 2 roles here, so let me.
Madam Chair, point of order.
Yes.
The time limit was not in effect when we started the hearing. And the people who are testifying now,
It was.
those weren't 3 minutes. Okay,
It was.
the
This is
clock
the
is
same
on.
hearing. It was recessed and we did announce it and we did have a 3-minute time limit. However, no one this morning went longer than 2 minutes, other than the prime sponsor.
Well, thank you, Madam Chair. I guess my watch was wrong.
Well, now I need to restart the timer. All right, go ahead. Sorry for the interruption.
Right. So I oppose the bill for 2 reasons. The first is I think it'll damage relationships between parents and children. The only difference that the sponsor talked about was that it has this mandatory provision that the school shall file one of these 169C petitions. And so the likely scenario is that you have an LGBTQ youth who is afraid to tell their parents. They may have talked about it with a guidance counselor or a coach at school or a teacher. Many LGBTQ youth are kicked out because of their LGBTQ identity. In fact, there's great statistics on it from the Trevor Project. So what's confusing to me is that under House Bill 10, if a teacher in that case or a coach doesn't tell the parent what they've been discussed in confidence with the child, they would violate House Bill 10, because under that one, you have to tell everything if there's clear and convincing evidence of a 169C, but that doesn't allow for potential abuse. So it's not like the parents beat up the child, it's the parent, they're afraid the child's afraid they would be thrown out. So you would be violating House Bill 10. But under this bill, you cannot tell if you have a good faith determination of imminent risk. And I would say being thrown out is an imminent risk, and you can have a good faith determination. So what you've done now by layering 2 laws on top of each other that have different evidentiary standards and different rules is a teacher or a coach or a counselor will not know what they should do, because in one case they'll get taken to court with a lawsuit, in the other case they could face termination from their job. So it just seems like a poorly conceived idea. My other objection to the bill is that I think that in general, children should have a right to be included in choices about their own lives, especially when they get to teenage years. New Hampshire Supreme Court, the case of Doe versus Manchester 2024, looked at this issue and said that while the parents' right to raise their children extends to the public school setting, it is not an unqualified right, and that school policies do not infringe on their right to raise their children as they see fit. So the question is, should children have a voice in their own future? Look at some other examples of law where they do. One is divorce cases. New Hampshire Supreme Court has repeatedly, going back over 40 years, held that by the age of 14, a child's preference is going to be crucial. A sufficiently mature child to play a large part in deciding that he needs a different custodial parent. Numerous cases. So in a divorce case, when they hit 14, we say, you should have at least some input into this decision about your life. But if you look at the text of this bill, there's 0 rights for the child. It's 100% for the parent and 0 for the child. So what happens? All of a sudden, children have the right to talk about where they want to live if they're facing a divorce. But if it comes to whether or not I want the conversation I had with my teacher to be reported to my parent, they have no rights. I'll give you another example, which is communication choices under
Mr.
the...
Trumbull?
Yes.
Your time is up.
Oh, okay, sorry.
Any questions? Representative Nato?
Thank you, Madam Chair. For clarification, do you represent a group or a lobbyist or anything?
I do not. I'm just here as an interested citizen. Thank you.
Representative Hall?
Thank you, Madam Chair, and thank you for taking my question. What was your second point?
Okay, another example of children having input, and we want them to have input, is the communication choices under the Americans with Disabilities Act. That's Title II. It says that the person who has a communication disability should be, what they request should be given primary consideration. So if a child says, I would prefer sign language or a communication board, we would give preference to what the child says. There was a House bill this semester that's working its way through. I think it was House Bill 1215, Representative Kofalt's bill about communication choices, very similar to the federal law, which has been in place for decades. We give deference to what a child says. I'm not saying that parents have no input and it should be 100% child, 0% parent. I'm just saying in other areas of the law, we look at the relationship between parents and children, especially when they get to be 14 and up. We say they should have some input. This bill in front of you gives zero input to the child's preference. So in other words, what it does is if this is 100 and this is 0, this bill says until they turn 18, it's 100% for the parent and 0% for the child. The day they turn 18, it flips. Whereas those of us who have raised children or been in schools, been around kids, we know that it's somewhere around 14, it starts to curve a little bit. We start respecting the wishes of children. That's all I'm saying is that this bill were to have a clause up at the top that says we want a policy that balances parents' rights and children's rights, that the children's input should be reflected and respected in the final decision, then it could make sense. But right, this bill, there's nothing in here about children's rights. They have no right to have any input in the decision.
Thank you very much.
Any further questions? Seeing none, thank you very much for your patience. I know you're a seasoned testifier, so I appreciate it. Aubrey Friedman?
Madam Chair, committee members, Aubrey Friedman, I live in Bridgewater. I speak in support of this bill. What's wrong with honesty? This bill is just about if you get asked a question, you actually have to answer it honestly. I don't see if teachers can't or won't do that, I don't trust them. And I think this is the heart of the problem here. We always hear, well, the school teachers and the superintendents, we want parents to be involved, don't just send your kids here, be part of the whole community, parents, kids, teachers. However, if you can't trust the teachers, the partnership is broken. So that's kind of an empty request of parents. If they're going to ask you a question and you're not going to answer them honestly, it's broken. So that's a problem. Now, secondly, the teachers, that's not like a doctor-patient relationship where you have the sacredness of confidentiality. Teachers, they're not. They are teachers and they should stay in their lane, just like all legal licensed professionals legally have to do. You stay in your narrow boundaries the way you were licensed. They're not a psychiatrist, so there's no sacred relationship like a doctor-patient. And lastly, for those situations that are always discussed in these kind of bills where the parent is, they're going to beat them up or throw them out of the house or do terrible things, that's already covered by 189.13 D, Roman numeral 2, where if you really feel that the parent, what you're going to divulge is going to cause problems, then you report them to the health authorities, which you would do now anyway. That's not changing. So I think that's a rare situation, but it does cover that kind of thing. And so that protects the teacher, actually, from if you really feel you're going to be thrust in the middle and cause harm to the child, then you have to report them. So I say no more hiding things from parents. And those are the reasons I support the bill.
Thank you very much. Are you willing to take questions?
Yes.
Any questions? Representative Woodcock.
Thank you, Madam Chair. Sure, thank you for being here. Listening to your interest with your determination about partnerships. Then what is the partnership between the child and the teacher? How does that partnership grow?
They're there to learn. They're not, that teacher is not their psychiatrist. And honestly, if there's, problems with secrets or whatever, maybe they shouldn't divulge those secrets. It's not the teacher is not your psychiatrist, is the way I look at it. So,
Follow up?
I wasn't suggesting that. I was suggesting to learn, you have to understand and trust, and you become a confidant, as teachers often do, with students because they're in that relationship. The other one is, I understand the ability of DHHS, at least your possession, that if a youngster was going to be abused, something was going to be hurt, then you report it to DHHS. But you have to have something factual to report to DHHS of the child mandated report. You can't say they think it's going to happen. Has it happened before? No. But if a youngster says to a teacher, if my parents find out that I'm gay or I'm lesbian, they're going to do this. Well, that's not a DHHS piece because there's no way to verify that. But that will send DHHS if they even refer it to the house. And you've just done what you don't want to do, is put that youngster in harm. Would you agree with that?
Well, I don't want to put them in harm.
Thank you.
Any further questions? Seeing none, thank you very much.
Thank you.
Sarah Terrell.
Thank you, Madam Chair, members of the committee. My name is Sarah Terrell. I am a citizen from Plymouth, New Hampshire. I'm coming to you. I actually wasn't going to speak on this bill today, but I am a former assessment worker for DCYF, and I am a current guardian ad litem, and the bulk of my caseload is children who have experienced abuse and neglect. And so listening to the testimony today, I changed my mind and I am up here. So what I want to highlight is that Senator Lang, when he was explaining his escape clause in this bill, and as several people have talked about it, how any credential holder is supposed to report if they have a concern. We all know that everybody's a mandated reporter. They're supposed to report concerns. However, 169C:29 says that when you make that report, you have to describe how a child has been abused or neglected, not will be. It's not minority report. So if you call central intake and you say to them, I am worried that this child might be thrown out of their house because they disclosed that they are gay, central intake will say, thank you very much. We will collect your information. This is going to be screened out. They will not send somebody to the house because there is not clear evidence of abuse or neglect that has occurred. They will tell you when that child is actually kicked out of their house, call us back. So the escape clause does not actually do anything helpful for teachers or for children, because when you call central intake, you have to report abuse or neglect that has occurred. You cannot call and report a worry for something that has not yet happened. You cannot call and say, I'm worried that Representative Noble might use drugs and therefore be unsafe to be around children, because we have no evidence that you have used drugs or may in the future use drugs, right? We can't make that report until something has actually happened. And so this escape clause does nothing. As it did last year, it does nothing. It's useless. I disagree with this bill for many other reasons, but this is a flaw in this particular bill that there's no workaround right now.
Thank you. Any questions? Seeing none, thank you very much.
Thank you.
Brian Hawkins.
Good afternoon, Madam Chair. For the record, Brian Hawkins representing NEA New Hampshire, here in opposition to Senate Bill 430. I have some written testimony, so I'll just summarize a couple of points. So hopefully we can get closer to back on track time-wise. The first one is is unclear to us why this bill needs to be passed, considering what was raised earlier, the provision in House Bill 10 from last year, the Parental Bill of Rights. There's two similar but different standards that one in HB 10, the other one here in Senate Bill 430 in Roman 1. So one of the questions we would have is there a different, are these different standards? Is there additional information that one compels an educator to divulge that another one does not? The second point is, educators welcome discussions and questions about how their child's doing in their class. But if there's an answer to a question that a teacher is somehow given an unsatisfactory answer to a parent, especially if it's related to school district policy, that's the sort of issue that ought to be addressed, through the chain of command in the school, through the principal or the superintendent. So we think that this bill sort of circumvents all that. It goes directly to the educator, and so it doesn't really afford them, that process. And if the if the school employee is following a school board policy and somehow that could conflict with this, it sort of puts the educator, between a rock and a hard place. Couple points. First, other questions that we are concerned about: who is the arbiter of what is material information, or whether an inquiry has been answered completely or not? I go back to several years ago when this was in Senate Education, this bill, and the attorney who handles educator code of conduct cases said that this was a subjective standard and would be difficult to enforce. Then completely and honestly, to the extent permitted by state or federal law, the issue we have here is this forces the educator to potentially juggle competing interests, determining what is material, then what is a complete answer, and whether too much detail violates some other state or federal law. And added to the pressure here is that they have this defined 10-day period in which, again, this bill goes directly to the educator, doesn't incorporate the whatever process that they follow in that particular school, going to the principal or school attorney or so forth. Is that the alarm? Okay, I'll close. So as I said, I do have written testimony. We're concerned that this doesn't, accommodate for things like what happens if you make a mistake or you forget something. But I'll close and happy to take any questions if there are any.
Thank you very much. Questions? Representative Cornell.
Thank you. Thank you for taking my question. And I don't know if you can answer this, but I can't seem to find who decides if you didn't answer it completely and honestly, because no one knows what the child actually told you.
That is one of the provisions that's unclear to us. Who is going to be the determiner of that? Is it going to be a Department of Education investigator? Is it going to be the school principal? What's the process here? Senator Lang indicated this was a process bill. There's actually not a whole lot of process that's outlined in this bill, other than some of the sort of repeat language we've seen in House Bill 10.
Follow up?
Well,
another question, yes.
And it came up this morning about potentially knowing that a child was going to harm themselves or whatever. And it dawned on me during lunch, and I think it's a school policy, if you know, that if a child says anything like that to anybody in the school, that there's a policy that immediately it must be reported, the parents must be called, and they must take the child for an evaluation. I think I'm right. Am I?
I know that the trainings that are given is, when in doubt, report. If there's a suspicion, it's not that educator's job to conduct an investigation per se. It's to convey what they've been told and report that.
Thank you.
Representative Litchfield.
Thank you. Thank you for taking my question. So clearly, we've been wrestling with this for years and how to get to the bottom of it. So I wanted to ask you, have there been any widespread surveys done to the teachers out there in the state, how they feel about this? And if so, has the question ever been put out there where if, let's say, a child is sharing with them and the teacher is carrying a weight, would there be a certain sense of relief with something like this? Because we're giving the teacher an out, a way to share without them, they can't help it, it's the law, without them breaking a confidence. And maybe it's something very important that the parents do need to know.
Sure. Well, to the first part of your question, we haven't put out a survey specifically about this bill. To the second half of your question, that's why I think this should be left to the processes that exist in the school now. I mean, there is the reporting processes we talked about for mandatory reporting, but then there's also going to your school principal and going up the chain, so to speak. And so I think this sort of, as I said, our concern is that this circumvents that and goes directly to the educator. If the educator does have a question about, whether something is, a thorny issue, for example, what happens if the school, and it's rises to a school district attorney type question? I mean, what happens if the school district attorney doesn't get back to the educator in 10 days? Or what, so I think I think there are other issues that this opens up, and we feel it's unnecessary.
Yes, follow up.
Thank you. And I just want to make sure that I understand. So you mentioned it circumventing. So are you suggesting that we pull the educator out of the bill and the parent go directly elsewhere up the chain? Or did I completely misunderstand what you were saying?
No, I was to that point. I don't think that I don't think that this. There may be a process within a school district that an educator is used to following, and so this sort of maybe circumventing is the wrong word, but supersedes that. Yeah.
Thank you.
Thank you.
Any further questions?
I'll hand it away.
Seeing none? Thank you very much. Are there any other pink cards? Anybody else? Oh, Representative Selig?
Thank you. For the record, I am Lauren Selig, and I serve on this committee, and I represent the town of Durham, which is Stratford County District 10. So thank you, Madam Chair, members of our committee. So although I'm now a state rep, I used to be a middle school and high school English teacher in Maryland. It's been a while since I've been in the classroom. I've lived here more years than I can count. Some of my former students are now over 40, but they still reach out to talk to me on a regular basis. The reason for that is because as a teacher, my job was not just to teach English and critical thinking, but it was also really important that I work on building solid relationships with those students. My students would talk to me about all sorts of things because I was also a class advisor, and we also had advisory, and the concept of one trusted adult has existed a long time. My students would sometimes rehearse with me how to talk with their parents about really difficult issues. If one of them had come to rehearse with me how to talk to their parent about a really difficult issue, and then I got a request like this, I would be put in a position of having helped a child figure out how to talk with their parents, and then outing whatever it was they wanted to talk about, regardless of whether or not I thought that was appropriate for me to be the one to tell the parent. The way this bill is written, I would have to disclose to the parent what the child said, even if what the issue was the child saying, I don't know how to talk to my parents about the fact they're fighting is making it hard for me to function, or I don't know about this. So it would have taken away and destroyed that trust that I built. Just to give you a sense of how deep the trust became, I taught in Maryland on 9/11. A number of my children's parents were later described in the newspaper as senior Pentagon official or senior NSA official, senior White House official. But the evening of September 11th, because, you know, cell phones were still pretty new and we all still had house phones back then, my home phone rang. I answered the phone. Person said, "Is this Lauren Weiss?" "Yes." "Who's this?" "You have so-and-so in your class?" "Yes, who's this?" "You don't need to know who we are. We've done your background check. So-and-so is going to come speak to you at school tomorrow. You cannot disclose to anyone what she comes to talk to you about. But we need you to be her advocate at school, and we need you to provide her the safety she needs at school." Click. Really strange call. The reason I got that call was because her dad was already on a plane overseas to go deal with the situation. She needed someone she could talk to at school about that situation without putting her family at risk. And she needed someone who could advocate for her with other teachers. Because of the fact that I had built a relationship where my students knew they could come talk to me about really difficult issues, she knew I was safe. She knew I would hold her secret that had to be held for her safety, her family's safety, and in fact, for national security reasons, she needed that information quiet. This bill would have potentially destroyed that. Let's say her parents had not been married and they had a hostile custodial arrangement and her mother reached out, I would have had to have disclosed that information, even though it would have been harmful to them. Was that my timer?
That was your timer. Yes.
Okay. I opposed the bill.
Thank you. Any questions for Representative Selig? Oh, Representative Litchfield?
Thank you. Thank you for taking my question. You brought up a really great point when you mentioned advisory. I think advisory is great, but I've questioned it for a while too, because sometimes advisory, they ask you to take on topics such as rape or domestic abuse, and the advisor may not be equipped to discuss that. That being said, though, I'm just curious, with a bill like this, would it be, how often do you think it would be used? You're an educator. Wouldn't this probably be rare? Or if a parent were actually to reach out and utilize something like this, would they be so desperate for information about their child that that's why they had to utilize this avenue? So, you know what I'm saying? Like, I'm trying to figure out, like, how often would this really be used? And like,
I do understand your statement. And
yeah.
I think about, you know, we had a young man in our school. He was not publicly out. He wanted to be a cheerleader, among other things, and his mom did not approve. And he made the cheerleading team. So, you know, he was one of the students I talked with. You know, he would come talk with me when he needed to just unload about things that were happening. We had a football game. Everybody in the community came, Friday Night Lights, you know, Maryland football kids, big deal. He was cheering, literally in the middle of a cheer when his mom pulled up to the game, saw him as a cheerleader, walked out into the middle of the field, grabbed him by the ear and yanked him out of there. And we heard the screaming all the way to the car, right? Just pulling him by the ear. I would imagine it was pretty painful. Is that abuse? In my opinion, yes, but it doesn't rise to the level of abuse that he would have been removed from his home. She could not accept her son for who he was, right? And at that point, like literally, it was just that he was cheering that made her that upset. The things that he talked with us about, had she called and asked me about, and I shared that with her about some of the things, I don't know whether he would have been removed from, you know, whether she would have thrown him out of the house or what other kinds of things she might have done to him. She was very clear she did not approve of anything other than her very strict vision of how he should be. And so to take away a child's one safe space, you know, I was his advisor for 4 years, you know. So I think about that. I think about, you know, one of my other students who I parented through high school because his own parents wouldn't do it. And even when his biological mother died, his stepfather didn't even bother to tell him. He found out from a neighbor. You know, we need to support our kids and make sure that they have someone they can go to when they don't feel they can go to their parents. I always counseled my kids to find ways to talk to their parents. That was my job. But I also helped counsel them on how to talk to their parents and figure it out. And that was part of the role as an advisor. And that's how we were trained as advisors, was if kids come talk with you about things, listen, ask good questions, and help them practice how to talk to their parents when they're ready. You know, I'm not talking about elementary school. That's a very different thing. You know, elementary school kids don't generally have such big issues. But even if they did, they should still have someone they feel safe to talk to.
Any other questions? Thank you very much. Becky Wilson?
Good afternoon. For the record, Becky Wilson, Director of Governmental Relations for the New Hampshire School Boards Association. We are opposed to this bill. Many of the reasons you've already heard, so I will not repeat those. However, we do feel like this is really putting teachers into a position that we are actually pretty consistently asking them not to put themselves into, which is to become sort of a decision maker about what might happen to a child around issues with abuse or neglect. Typically, when educators are trained on how to make a mandatory report, that is their obligation, is to make a report. It is not to make a determination about whether or not they feel that something has happened, will happen, could happen. They are not to do their own investigations. That's also true around things like the bullying statute and things like that. We are trying to work with educators on the fact that they are mandatory reporters, but they are not decision makers in terms of what is happening in those situations. This bill puts them in a position of trying to actually guess at what they think is going to happen or might happen, or to potentially read into situations about things that have been said potentially and guess at how both parents or any parents may react, not even necessarily the person that is reaching out to the staff member, but they have to put themselves in the position now of trying to guess at what the other parent also might, how they would react to a certain situation. We share the concern about, I don't understand how you prove or who gets to decide if the answer was honest or complete. Are you going to go back in time if you find something out later on and then say, actually, you don't feel like that answer was complete or truthful? There are also a number of other bills that we think have some interplay with this bill, including House Bill 1565, which is about penalties for false reports to DCYF that could be made by an educator who in good faith is trying to do what they feel is the right thing, but then later on that turns out to be a false report and there are penalties for that. Also House Bill 1376, which talks about the ways in which parents have the right to raise their children, and whether or not there's some interplay with this bill and that bill as well. And just a reminder from a human standpoint, any of us who have parented middle or high school age students who are going through adolescence, it's very normal for them to want to separate from their parents during that time. That is a very natural stage of adolescent development, to come up with their own ideas about things, to not talk to us as parents. That is really typical of that age. It's not because parents are doing anything wrong. It's not because the kids are doing anything wrong. That is what they are built to do during that time of their life. We all feel like, well, I'll speak for myself, having gone through it 4 times. I think there are times of all of their teenage years where I feel like I have no idea what I'm doing and nobody is talking to me about anything. It's not because anything is wrong. That is just how they are. And if they're talking to someone, I think that should bring some comfort to parents, not necessarily create a situation where parents feel like they're being kept in the dark. And most educators, the door is open. If you want to have a conversation with them about your concerns, please do that. I think most teachers would have those conversations honestly. There are protocols and processes for educators if there are safety concerns about a child from a mental health standpoint or some other standpoint. Nobody is going outside of their scope of practice, for lack of a better term.
Thank you very much. Any questions? Seeing none? Thank you. Are there any other pink cards out there on Senate Bill 430? Seeing none, I will close the hearing on Senate Bill 430. So, sorry. Yes, still on Senate Bill 430. Go ahead, Vanna.
We will open the hearing on Senate Bill 431 relative to violations of the prohibition on teaching discrimination, and I recognize the prime sponsor, Senator Lang.
Good afternoon, Madam Chair, members of the committee. I'm Senator Tim Lang from Senate District 2. You have a fairly straightforward bill in front of you. It adds 3 words to existing law. The words it adds is intentionally or knowingly. So I want to kind of walk through what this bill does so you're clear. It adds a mental state to be clear what we're talking about. So no pupil or in any public school of the state shall be intentionally or knowingly taught, instructed, inculcated, compelled to express a belief in or support for any one of the following. And there's 4 things in that list. And I think we can all agree that no one should intentionally or knowingly teach these things. So the first one is that one's age, sex, gender identity, sexual orientation, race, creed, color, marital status, familial status, mental or physical disability, religion, or national origin is inherently superior to people of another age, sex, gender, identity, sexual orientation, race, creed, color, marital status, familial status, mental or physical disability, religion, or national origin. I think it's pretty clear. We probably don't want any of that taught, that one person is better than another person based on some marker. The second one this does, it creates, again, a mental state to say you shall not intentionally or knowingly teach this, is that an individual, by virtue of his age, sex, gender, identity, sexual orientation, race, creed, color, marital status, familial status, mental or physical disability, religion, or national origin, is inherently, by those factors, racist, sexist, or oppressive, whether consciously or unconsciously. Again, I don't think we want to say that any one of those things are inherently racist in and of themselves just because you have that marker. The third thing, an individual, so again, remember, this is not knowingly or intentionally teach this, that an individual should be discriminated against or receive adverse treatment solely or partly because of his age, sex, gender identity, sexual orientation, race, creed, color, marital status, familial status, mental or physical disability, religion, or national origin. Again, I don't think we want anybody knowingly teaching that to our children. And the last one, that it does, again, you shall not knowingly or intentionally teach that people of one age, sex, gender, identity, sexual orientation, race, creed, color, marital status, familial status, mental or physical disability, religion, or national origin cannot and should not attempt to treat others without regard to age, sex, gender, identity, sexual orientation, race, creed, color, marital status, familial status, mental or physical disability, religion, or national origin. So again, I think those 4 things, everybody in this room would agree nobody should intentionally or knowingly teach the children, that we should treat people differently based on those factors, right? However, it does create an academic carve-out, right, in the statute that finishes again, that while that's there, it also says, though, under Section 2, nothing in this section shall be construed to prohibiting discussing as part of a larger course of academic instruction the historic existence of ideas and subjects identified in this section. So I think we all know in our history, those 4 things had various actions in our history, whether you're talking about World War II and the treatment of the Jews, whether you're talking about slavery, whether you're talking about the KKK. Again, those things taught, and those are our history. And teaching history is not a bad thing. However, teaching somebody that, as I said, because of someone's age or sex, they are inherently racist, is probably inappropriate, right? That may have been the belief, and you're talking about it in past tense when you're talking about history, but not talking about it in current tense. So again, the bill is fairly straightforward. I think we all agree that nobody should knowingly or intentionally teach these things to our children, and the bill just makes sure that that doesn't happen. And then again, it was interesting in the previous conversation, we were talking about skipping levels of disciplinary action, where it goes. And again, this has the same penalty, right? This law is that it's considered a violation of the teacher code of ethics. And I'm pretty sure, being a former school board member, in almost every CBA agreement I've had, disciplinary actions are outlined exactly how you manage them when there's a disciplinary action required. And in teacher CBA agreements are the process for which that involves. So nowhere in here do we override the CBA agreement and the teachers agreement. If someone is knowingly or intentionally teaching this and they're brought up as a violation of the code of ethics, then they would then be subject to an investigation. If it's proven, they would follow the disciplinary measures outlined in the teacher CBA agreement. So I'm happy to take questions.
Are there any questions? Representative Hall? Thank you, Madam Chair, and thank you for taking my question. Are you able to give us an update on where this is in the court system right now? Related legislation.
So again, this bill came forward. I worked with the Department of Education under the former commissioner to draft this language. It was language that was meant to clarify the court case that was outlined, and it was felt that this was a remedy. As leaving it otherwise, it's ambiguous whether or not in passing you made a comment that wasn't meant to be intentionally or knowingly. It wasn't that kind of statement. So it was to provide clarity. And again, these are the highest levels of mental state. As a former police officer, mens rea, you have 4 mental states. This is the highest level. You have to prove this is extremely difficult. And yet, so you would have to, for a teacher to be, or a credentialed educator to be found in violation of that. It's a very high level of proof.
Follow up? Thank you. Are you able to give us an update on, are we awaiting a ruling right now?
Not that I'm aware of. I think there was a ruling already issued, and this is a response to that ruling. I don't know what the outcome of any other actions was, but there was a stay, and the stay of the law, this was one of the items mentioned, and that's why it's made to clarify and make clear.
Thank you. Any other questions? Representative Selig?
Thank you, and thank you for taking my question. Obviously, part of our history is that people were slave owners at one point. Some people were enslaved. If a teacher makes a statement that owning slaves or having been a slave owner was morally wrong or was bad, how does that fit into this bill? Would that teacher, because they're making an intentional statement, right, about judging people of the past, how does that fit in with the language?
So again, if you're teaching in the form of history and past practice, I think it's clear that everybody in this room would that slavery was inappropriate and people who owned slaves were morally wrong. Right? I don't think anybody would say it was morally right. So again, teaching that aspect of it as a historical context is fine.
May I ask a follow-up? So if the student took away from that because primarily the slave owners were of one race and primarily the enslaved within our own country were of another race, that therefore their interpretation of the teacher's comment was that the one group was better or worse than the other, right? How would that relate to this if they came home to their parent and said, my teacher told me this and said that this one's good and this one's bad because of slavery or whatever?
So again, if taught in terms of historical context, not present day language, right? Not saying all white people own slaves and therefore all white people are racist and should be there, I think that's inappropriate. Right? That would be in violation of this. But if you say, again, probably the key word you said, there were people of both races or multi-races that owned slaves, right? And that slavery in and of itself was bad, right? And is morally wrong. There's nothing wrong with that.
Representative Cordone?
Thank you, Madam Chair. Thank you for taking my question. I may be wrong, but I thought we were still awaiting the appeal to the circuit court's judgment that found this unconstitutionally vague. And if the answer to the unconstitutionally vague is saying intentionally or knowingly, do you think that's going to pass muster with the court?
So what I'm telling you is I spoke to the Commissioner of Education. He felt based on the court ruling out of the New Hampshire court that this would solve the problem.
But that's not what the court said.
I'm just telling you that was their interpretation, and therefore that's how this bill came about.
That would be Commissioner Edelblut?
Edelblut. Remember? No.
Representative Balboni?
Thank you, Madam Chair. Thank you for taking my question. How is this different from the bill that was passed last year? I believe that was, I could get the right number. And I believe there was a non-concurrence with it.
So I'll be happy to answer that question. So again, this bill passed the Senate last year, passed the House. The House amended the bill. The amendment that the House put on the bill, the Senate could not concur with. So you passed it, but you amended it. And when it came over to the Senate, we wouldn't agree to the amendment.
Any other questions? Seeing none, thank you very much.
Thank you.
Representative Balboni has one more follow-up.
Thank you for indulging me, Madam Chair. I had it on my tip of my tongue and I forgot it. So we get back to the historical perspective. You're saying that the discussions can be all related to historical perspective and then there wouldn't be affected in this bill. But what about current events classes, discussions of things that are happening every day in the news, and students would draw their own conclusions from their discussions, and it's not necessarily something that the teacher would be directing, but it would come up in the nature of that class. Could that potentially be a violation?
Well, again, you'd have to knowingly, intentionally, teach one of those four things, right? That's what those four topics we said, that any one person is inherently racist and one person is of a lower class than another person based on those characteristics. So again, I don't think that teaches that at all. Again, I think that in historical context, again, I made this comment. I was at a school talking to just in the last couple of weeks, talking to a bunch of students. And the statement I made to the students was, I want your teachers to teach you how to think. I don't want them to teach you what to think, right? So again, if how that's phrased and how they do that, maybe are you teaching them what to think or you're teaching them how to think? And so I think that that's probably the most important thing that comes out of here is that this law is everything. It's not teaching them what to think, but teaching them you should be teaching them how to think.
Can I just brief follow up on that? So if there was an assignment that encouraged the students to put their perspectives in writing, and that was the assignment, it wasn't specifically teaching that perspective was right or wrong, but it might lead to a discussion where you might have different perspectives being discussed, but it is actually an assignment. Sure. That to me is a little bit of a gray area that I don't see addressed here.
So here's the answer I'm going to give you on this, is that teachers have an enormous amount of power and influence in the children. So I'm going to give you my youngest daughter, Casey, who's attending PSU, and she was taking an English class, and the English class was using current events. The writing assignment that was given to her by the public university's teacher was, write about a time your parents misgender identified you. Now, if that's not a leading question to tell, like now my daughter either has to make the statement, I was never gender identified, and now she's worried about not, because she won't do the premise of the teacher's question, that she's not going to get a good grade, right? And so teachers hold enormous amount of influence on our children. And so how a teacher phrases something and how a teacher does something has also the enormous same impact. So that teacher could have very well written that statement completely different and not lead to the conclusion or make the assumption that I had gender identified my daughter and therefore she should write about it, which is what the conclusion that my daughter drew from the question, the way the question was phrased and worded. So this bill is about making sure teachers understand that enormous influence and how you phrase things and what you do things will have an enormous impact on a child.
There's actually a very good FAQ that the Attorney General's office put out about this. So I will share that with you, and I think it would answer some of your questions. Any other questions? Seeing none, thank you very much. We're going to do 3-minute testimony. Aubrey Friedman.
Madam Chair, committee members, Aubrey Friedman, I live in Bridgewater. I speak in support of this bill. The reason this whole divisive concepts came about was because some teachers, just some, could not check their politics at the door when they go into their classrooms. When I was growing up, we never knew, even like history, civics, any social studies, we had no idea what our teachers' political affiliations were. You just didn't know. And I don't think that same thing is true these days. When the bill went into effect, there were, I remember hearing about teachers posting that they were furious about this divisive concepts law, and they were going to ignore it and do just what they wanted anyway. So I think there was a problem, and there is a problem. This bill, by adding those words, I think it gives added protection for teachers, because it's true, you could say something or something might be misinterpreted, like you're advocating discrimination of some sort. So by adding that intentionally or knowingly, I think this is added protection for teachers. Secondly, again, I'm going to read that section too, because I think it's critical. Under 193.40, nothing in this section shall be construed to prohibit discussing, as part of a larger course of academic instruction, the historical existence of ideas and subject identified in this section. That's pretty open. It's discussion. You can discuss anything. You just can't push your opinions on students who are, still somewhat impressionable. And lastly, this does bring up the question of what can you really teach? You have to teach kids to learn how to read and comprehend, but once they already learn that, I think teaching becomes more a guidance. They can learn on their own, basically, and you guide them through. If you have controversial historical issues that you're studying or are going to be discussed, you assign essays, books, videos, whatever the media might be, with differing viewpoints, and let them learn for themselves. You can't really teach them that. And that's, to me, what teaching really should be. And that can be done because, especially with history, what version of history would you be teaching in a history class? I mean, there's wide ranges of that, how people feel about, different issues, wars, and what have you. So I think guidance is the key, and this can all be done under this 193.40 with these three words being added. Again, just an open discussion, and those are the reasons I support the bill. Thank you.
Thank you. Are there any questions? Seeing none, thank you very much. David Trumbull?
Good afternoon. Thank you, Madam Chair and committee members. I'm David Trumbull from the town of Ware, and I oppose this bill. First of all, adding the scienter clause does not make the law constitutional, as was brought up in questioning of the sponsor. The court, in its issued two rulings, there was a memorandum in 2023 and then a final decision in 2024. And the district court said that there were three reasons for its decisions. First is that the law implicates the First Amendment because of vagueness. Second is that there would be arbitrary enforcement with severe consequences for teachers. And third was the lack of a scienter requirement. So this bill only addresses the third out of the three. It does not remove the problems with vagueness as to what topics the law bans, and it does not remove the arbitrary enforcement and the corresponding impact on the teachers. The court said that the law was so vague it doesn't provide teachers with fair notice of what can and can't be taught, and it would sow confusion and leave gaps about what's permitted. The court, in its decision, noted after a weeks-long trial that there was indeed self-censorship, that in order to avoid the arbitrary enforcement, teachers were resorting to self-censorship. They were taking good issues off the table because they didn't want to risk losing their job. They had numerous teachers testifying about not using books describing the realities of slavery because they were afraid that the discussion would go too far and then somebody would claim that they were offended by that. And there was also like a model UN teacher who limited the ability of their students to research certain topics. So because of vagueness, because of arbitrary enforcement, and because of strict penalties, teachers will take things off the table. That's self-censorship. That implicates the child's right to learn. The court also said that there would be no way to discuss topics that involved implicit bias because you couldn't teach it without violating the law. So a current example would be the question of the Kavanaugh rules for immigration. Judge Kavanaugh of the Supreme Court said that it's okay to detain somebody if they meet one of or some of these four criteria. That is, that somebody has a apparent race or ethnicity, an accent or non-English speech, present in certain locations like day labor sites, or employment in fields often done by undocumented workers. Some people might say that that's implicit bias, that it's now legal for ICE to stop somebody who looks Hispanic and is speaking Spanish, or it is at Home Depot. That can't be discussed in the school because that's a discussion of what is discrimination, what is implicit bias. The court said that is could not be discussed fairly under this bill. A teacher wouldn't know. The other example I would give you is the Attorney General for the state in the federal court case said that it would be an admission, failing to offer disclaimers would form the basis for liability under the statute. So somebody, he said, the sponsor said, I want to teach you how to think, not what to think. So if you have a robust discussion, every time somebody says something that might be offensive, the teacher would have to say, okay, now that's this student's opinion. It's not anything that I'm teaching you in this class. If the teacher doesn't interject that statement after each claim, then the teacher would form the basis for liability under the statute. So I think the bill would actually reduce the student's ability to think, and it would still run into the same constitutional problems. Thank you.
Thank you. Are there any questions? Seeing none, thank you very much.
Thank you.
Brian Hawkins?
Thank you, Madam Chair. For the record, Brian Hawkins, representing NEA New Hampshire. We're here in opposition to Senate Bill 431. And Mr. Trumbull actually covered just about everything that I was about to say. So I'll say ditto, and also that just to the question that was posed earlier about the status, the court. This case is before the First Circuit Court of Appeals, and I don't have a crystal ball as to when court will make a decision, but it could be any day now. And so I would just add that that's another reason why I think it would make sense, at the very least, to wait until to see what all of the issues ultimately are once the process is complete, because as it stands right now, the only fix here truly is to repeal the entire statute that was passed in 2021. And that will close my testimony. Thank you.
Any questions? Representative Woodcock?
Yeah, sure. Brian, what is the current legal status of that bill?
Currently, that statute is enjoined, and I'm happy to provide the decision itself, Judge Barbadora's decision. I guess it was emailed to you.
Okay.
Oh, thank you. Yep. Thank you, Madam Chair.
Yep. Any other questions? Seeing none, thank you very much.
Thank you.
Are there any other pink cards on 431? With that, we'll close the hearing. We'll open the hearing on Senate Bill 434 relative to regulation of public school materials, and I recognize the prime sponsor, Senator Lang.
Thank you, Madam Chair. Thank you, members of the committee. I am Senator Tim Lang from Senate District 2. Again, what you have before you is what I consider, again, a process bill. This bill creates process where if a parent discovers a book in a library that she thinks or he thinks is harmful to minors, which is a definition in statutes under an RSA, which is in the bill. We use a very definitive definition, and it's the whole chapter 571-B:1 is nothing but definitions: harmful to minor, knowingly, sexual conduct, and minor, and a definition of minor. So if a parent believes that it meets the definition as defined by statute, they can just fill out a form and ask that that book be reviewed, in this case by the superintendent. Just review the book, let an educator look at it and decide whether, given the light of the law, if they think the book is harmful to a minor. If it is, the superintendent's able to withdraw the book. If it's not, then it's able to stay. If the book stays and the parent feels that they want to appeal the decision of the superintendent or their designee, they can appeal to the school board. Again, school and education body, local control, allowing the school board to review the book and review the material, and then either concur with the superintendent's decision that it is either is or is not harmful material. Probably the most important thing about this bill is it outlines a process, again, a universal process that all parents, no matter what school district they're in, would be able to follow with a known outcome and known guidelines, how many days it takes, those kind of things, rather than a parent submitting a complaint and it going absolutely nowhere for months on time. This outlines a procedure. Within 10 days of receipt, the superintendent's got to acknowledge it. Within 25 days, he's got to make a determination. And then the parent has a certain window of time to appeal that decision to the school board. And then the school board has a window of time in which they have to act. But it's all known in certain quantities, with one exception. That's at the bottom of page 1. Says the superintendent or designee within the school day, 25 school days of notice of receipt of the complaint or otherwise agreed upon by the parties. So if the parent says, for whatever reason, hey, the superintendent asks and says, I need 2 more weeks, and the parent says that's fine, then that's okay. They can do that. But otherwise, the superintendent would have, unless agreed upon by both parties in this process, the superintendent would have to meet the timelines that are required. So that's the short version of the bill. It's, again, a simple process bill. It allows a parent. So I served, and I've said this before, I think of running a committee. I served on in a school budget committee for 2 terms, served on a school board for two terms. I know that not every school board member, and I know that not every principal knows every book that's in his library or her library, right? And there may be a book that gets through that may have an inappropriate piece to it. I use this discussion, again, I mentioned earlier, I was talking to some kids at a school in a civics and government class, and we were talking about the fact that we were using a rape discussion, right? There was a book, this all stems from a book that had a very graphic rape depiction that was put in a middle school, and it felt it was inappropriate. I was, in my previous life, I was a police officer, and I investigated sexual assault and child sexual assaults. How you talk to a 6th grader is, especially about sexual assault, is completely different than how you talk to a senior or a 40-year-old man or woman that's been subject to a rape. Those are completely different conversations that need to be age appropriate, right? So if a book slips by and is in the 6th grade library that has a horrific depiction of a sexual assault with graphic detail, probably not the right language to use to teach that child about rape. Doesn't mean you can't have the conversation, but not the right language for that age appropriateness in that school. So if a parent finds that, there should be a process, a known process for them to challenge that book and say, can we move this up to the high school instead of having it in the middle school, where it may be more appropriate? That's what this bill does. It just allows for that process to occur and makes it uniform across the state. So every parent of every child in the state of New Hampshire has a known process rather than one that may be different in every single school district. That's it.
Representative Hall?
Thank you, Madam Chair, and thank you for taking my question. You mentioned libraries. Is this strictly about libraries, or is it about school plays, school classrooms?
So let me find the exact section in the bill so I don't misspeak again. So it's in the school itself, anywhere in the school.
I just wanted to make sure that you only spoke about
that's fine.
libraries.
Any other questions? Representative Baldoni?
Thank you, Madam Chair, and thank you for taking my question. So if I read down through anything in the school, this would refer to any printed matter, visual presentation, web-based content, live performance or sound recording, including but not limited to books, magazines, motion picture films or videos, pamphlets, phonographic records, pictures, drawings, photographs, figures, statues, plays, dances, or other representations that are provided by the school district or by school employees, volunteers, guests, or speakers. It's a very broad-based bill. It really affects everything that is going on instructionally and just in the school itself.
So I think we'd agree that if material in any of those categories are deemed to be harmful to a minor, they probably don't belong in our schools. I think we all would agree with that. No. Okay.
Follow up, please. So my question is, in terms of enforcement, so you're saying that a parent can literally challenge for any of these reasons. So if the school has scheduled a guest speaker and has that on the calendar, and procedurally, what is a parent going to come and say, I don't want that guest speaker to come? And then what does the school do? They've already scheduled the speaker. Does that get put on hold? Similarly, if I'm putting on a play and a parent comes in and objects to a scene or just a line in that play, do all these have to go on hold while this procedure makes its way through?
So again, that would all be within the control of the school board or the superintendent, who can act as fast or as slow as they want within the timelines.
Representative Cornell?
Thank you, Madam Speaker. Thank you. Governor Ayotte vetoed 324 last year because of overly broad language, which would open up the district or the state to lawsuits. Could you tell me exactly in your bill what took care of the overly broad language?
So again, I took that to mean that's why I went to a statutory definition of harmful to a minor. The previous bill didn't have that definition. This is a clean definition that's been in state law since 1969 and been used on multiple occasions for various reasons. So again, I took it as to me to make sure it was clear what is the material that could be challenged, which is, again, materials that are harmful to minors, as our definition in statute is harmful to minors.
Representative Perino?
Thank you very much, and thank you, Senator Lang, for taking my question. I just want to clarify. You do not have any specific material in mind with this bill. This is strictly a policy that the school board can enact, correct?
This is a procedural bill, yes. It strictly is a procedure to enact with, this bill's been called the book banning bill. There's not one book banned in this bill. Right? Nowhere. All it does is create a procedure that allows the challenge of material that might be accidentally got through and was inappropriate. I'm not saying there's any malfeasance on anybody's part. The book could have just got through, or the material could have just gotten through, and it was caught by a parent. And so let's create a process for that. Any more than I think a teacher could use this process. If they found a book that they felt was like, wow, this probably doesn't belong in our library, they can go to the superintendent and say, we probably should pull this, right? They process, can exist. So I don't think it doesn't ban a single thing. It just creates a process. So something that might have gotten through that shouldn't have gotten through can be reviewed.
Representative Freeman?
Thank you, Madam Chair. Senator Lang, golly, should we rename this the House Education Policy Administration and the Senator Lang?
Committee, apparently, it sounds
Yeah.
like it, but today I figured it's my first annual meeting of the committee.
He's a genius.
He is a genius. Thank you. Thank you.
Although I do appreciate the chair scheduling all my bills in one day. It makes it much easier.
I do have a question for you, hypothetically, but as a former police officer, you may have an answer to this. So if I, as an adult, were to provide a minor child who's not related to me by blood or relation, with any type of pornographic material, what might the legal ramifications of that be?
So in any other circumstances, you would be charged with a crime.
Thank you.
Representative Woodcock?
Thank you. Just a clarification on Representative Pettinell said that this is enable, and then she went on to discuss what that was. This is not an, do you see this as enabling legislation?
No, so to her point, it has, it's a mandate. It's an outright mandate on the process. But what I will say is that these are not the only conditions that, if you read on, let me find the line. So line 16, at a minimum, the complaint resolution process shall provide, right? So the school board has flexibility to change, but we set some minimum standards on dates and times that they can do. If they want to make it, instead of 10 days, want to make it 7 days, that's completely within their right, but at a minimum, it has to, you can't go beyond 10.
Follow up? Thank you. I do agree with you, Senator Lang, which probably not often, I do agree with you on your age appropriateness. I think that the case you made about the rape definition or however that book or show, however it came in middle school, probably isn't appropriate. I would concur with that. But I do have, using that same criteria, I do have concerns that things at a high school may be age appropriate. They may be a minor in terms of 18 years old, but the discussion could very well be age appropriate. Or the theater performance could be age appropriate. Or the guest speakers may come in and have very, on both sides of the discussion, whatever the issue happens to be age appropriate because the 17, 18, 19-year-old, 17, 18-year-olds, 16, 17-year-olds, kids in the senior year of high school. So I find this, the bill, age appropriate, I don't see there, but I hear what you're saying. But I do have concern that things at the high school particularly, that out of place would seem incorrect. But different pieces of work, different guests, different visitors, the discussion that they bring to the table for students to talk about afterwards, providing their point of view. I think this really limits the opportunity for schools to allow students to be exposed to things that are age appropriate, but under 18.
So thank you for the question. So again, if you look at line 15 in the bill on page 1, and again, is a material that is harmful to minors, age inappropriate, right? So is one of the challenge points. So again, I want to remind everybody, educators are making this decision. This is not us making this decision. This is the superintendent of the school and the school board are making that decision. This is not anybody else making the decision. So if an educator thinks that a book is age inappropriate, it'll be removed. If an educator thinks it's not, it won't. This still gives the power to the education system. It is not us absorbing process. It just gives the parents a known process.
One last question. Thank you. It goes back to the concept of minor. Minor. I see an age appropriate after the comma, but it goes back to the process of minor. We're using the age of 18 as a minor or 17 as a minor, harmful to minors. So that's the part that becomes difficult, and I do think it does limit the opportunity for instruction and conversation, particularly at the high school level. But it does say, I understand inappropriate offense, I get that, but you precede that with harmful to minors, and minors is a definition by age. So that's the part I see with that concerns me, as well as going back to the disruption that makes, I understand this is a process that's afterwards, but if a school play started in the county, does that mean every school play has to be approved prior to being played by the superintendent?
Well,
No,
I
we're not
believe
gonna
they
have
already
it.
are.
It would be after their complaint. It goes back to, I think, Representative Balboni's issue. It goes back to after the kids come home and here's my script and I get selected for the play. And, oh my God, the parents are, you have to say that? And then it's the wheels stop. Then they go to school and then they complain. Now this is the 17-year-old, senior in high school. Oh my goodness. And everything stops as you go through this process. So it really is disruptive. I understand the goodness of this, but it's really disruptive and I think impinges on public education for the good of education for kids who are age appropriate, but maybe legally minors. Thank you.
Any other questions? Representative Balboni.
Thank you, Madam Chair, and thank you again for taking my question. In terms of the process, I'm going back to a single complaint. So one parent.
I'm sorry, where are you on the bill?
I'm just talking in general about a parent makes a complaint, and I am a superintendent, and I have 7 towns in my district. The complaint comes from one school. Now I make a decision, and my decision is that it's fine, or if my decision is that it's not, does that translate into now the superintendent has all of those towns? Does that decision apply to all of those schools within that superintendent's purview?
So again, the superintendent is the superintendent for the district. If the district's made a determination the book's inappropriate, and in the district, the book's inappropriate. So what I will say is originally I had this as principal, and the Senate Education Committee changed it. I had it the principal because I thought the principal would be the most age appropriate, person who knows the age range and be able to identify books based on age best. And I had it at the principal, but the Senate Education Committee chose to move that to superintendent, and I believe they did it because of the potential legal consequences, and that somebody other than a principal should look at it.
Follow up, please. Follow up. The follow up is also what would happen if the complaint was denied? It went through, the school board denied it, everything went through. How long is that decision good for? I mean, say a parent decides, for that year, and you've got another parent come in the next year and makes the same complaint.
So again, it goes back to the definition of harmful to minor in our statute. If a book is harmful to a minor, it's not time specific, right? So if it's harmful to a minor, again, someone asked me about if I gave a pornography to a child, it doesn't matter if I did it this year or next year, it's still going to be pornography and it's going to be inappropriate. I'm still going to be charged with the crime, right? So again, I don't think in any circumstance, once a book's been determined to be harmful of a minor, we should then put it in the hands of minor.
Excuse me, you misunderstood my question.
Okay.
If the superintendent had decided that it is not, and then another parent, however, like a month later, brings the same exact complaint, it's already been determined by the superintendent that it is not, fits that statute. I mean, could conceivably another complaint come the next month or the next year, or how often are these complaints going to come up? There's nothing in this bill that addresses repeat complaints about the same materials.
You're absolutely right. There isn't none any more than is anything in statute that does multiple complaints against teachers. The superintendent's going to take every complaint against a teacher. Just because I already have a complaint and some other student comes in and files a complaint doesn't mean I'm going to ignore the second complaint. The teachers, they're going to take every complaint on its merits.
Representative Selig?
Thank you, and thank you for taking my question. I think about a book that was used with my children when they were in elementary school, called The Only One Club. And it was a lovely story about how a child felt like they were the only one of something. And then through the course of the book, they learned that everybody in the class is the only one of something. Every single child has something that they're the only one of. And in the end, they make little badges for everybody, including the teacher, because she's the only teacher in the room. It's a very sweet story about how to be inclusive of everyone. So the book, I think at one point, one of the children's uniqueness is that they're the only one with 2 moms, and someone else's is that they're the only one with 6 brothers, and someone else's is they're the only one of a particular religion. So if a parent who objects to people having 6 children or objects to religions or whatever comes in and files a complaint through this process saying that they believe that book is inappropriate for kindergarten and first graders, for whatever reasons they claim it's harmful to minors to hear these thoughts. And so it goes through the process, and the superintendent decides this book is fine. It's not doing any of those things. And they continue to go through the process. Where does the level of complaining stop? So if we have 5 other parents who come in and make literally the same complaint where it's already been determined, and this is again reflects Representative Balboni's question, how many does it, because now we've got 5 parents who say, I don't like this book, does it have to change the superintendent's position? Or if the superintendent has ruled this book is fine, can we just say this book has already been ruled and we don't need to go through any of this process again? We're wasting time, we're wasting money, we're wasting resources on
I would not suggest that at all, that you should waive any future complaints on the book. If they've already done the study, then it's literally just repurposing the letter that you previously did and say, this book's been reviewed and here was my finding. I don't think that's an objection, but I think that a parent has the right to make the complaint and to have a process in the process of the complaint. You should not tell a parent you don't have a right to make the complaint.
That's good. Another question? Sure. Okay, thank you. So on a related note, you talked about a book depicting rape and being available at a middle school level. And I agree that there's different ways to talk about sexual assault and other kinds of things. And I know that organizations like Haven have designed programs where they come in and talk with children, starting at the preschool level, about what are safe touches and what are uncomfortable touches and whatnot, so that children are able to identify if things are happening that they may not be aware is not appropriate. And so at what age is it acceptable for children to be able to see a book in their library that reflects potentially a traumatic experience they've had, that they can say, wait, that happened to me, that shouldn't happen to me, or wait, that happened to me, maybe I'm not the only one that's happened to, and to feel safe to talk with someone about it? Where's the minimum age for them to be able to have that experience?
So again, it goes back to the discussion. I put educators in charge of making those determinations because they deal with children, right? That doesn't mean you ignore the complaint. It means that an educator whose job is to work with children should know what the right, in my conversation, going back to my sexual assault conversation about how you talk to different kids. An educator's going to know that, just like I knew as a police officer after being trained by the FBI. How you talk to different people is different, and how the words you use for the same exact act is completely different, but it's age appropriate. So we put an educator in charge of making that determination on whether this book has value or not and is appropriate for that age range. We didn't put the legislature, we didn't put the court system in charge, we put the educators in charge.
Representative Litchfield? Thank you, Madam Chair, and thank you, Senator Ling, for taking my question. We've heard several times now what happens if a complaint is brought about with the same book or the same type of material several times over. Would you say that if a complaint continues to come up about the same materials and it's several different parents, that maybe it's time to take another look or some time for self-reflection?
Absolutely. Again, the perspective is everything. And so after 5 complaints, you may go, maybe I missed something, and you want to review the book again. That's going to stop a principal from doing that if they choose to, right? If they continue to get complaints about a given book. They may want to review that again and say, somehow I didn't see the perspective that the parent's talking about. Maybe review it again and look in that perspective. So nothing stops them from doing that either.
Representative Terry.
Yes, thank you. I want to come at this from a different direction. Without such a clearly defined process that would be statewide, so it would apply to everybody, that's as clear-cut, 2-step process where the arbiters are, as you say, the educators, the superintendent, and then ultimately the school board, and then in the final analysis, the parent, if the parent isn't satisfied with the decision of the superintendent and the school board, because then the parent can withdraw the student from the school or can go political and try to change the makeup of the school board, which has happened all across the country.
With any luck, they go to open
so
enrollment.
where are we left if we don't have such a clearly defined process as outlined in this bill? what kind of chaos are we left in?
Well, again, you end up in an ambiguous, vague stage where you can't make determinations, right? There's no clear, and what happens in one school district completely different in another school district. So again, I think the whole purpose of this is not to ban any one book and say, I think this book's bad. It's strictly to create a uniform process that every parent gets treated the same in the state of New Hampshire in how, if they have a concern about a book and how that concern is addressed. They'd have a uniform process no matter what district you live in. They'd have a uniform process.
Follow-up?
So in a sense, what I'm hearing you describe is actually an ultimate remedial process to address a situation or situations across the state where there's uncertainty and ambiguity and perhaps arbitrariness.
Sure. So again, the issue is, I use that definition of harmful to a minor for a reason, is because it established a state standard so that the standards used in one district for determining this, it's harmful to a minor or something other form, like it's not pornography, so we're okay with it. That's the only determination they make is on that one classification. It allows for a standard practice so that it's evenly handled in every school district.
Representative Selig?
Sorry, thank you. To follow up on Representative Terry's question, we already have a process by which parents can appeal to a school district if they oppose a book and also opt their child out of reading any particular book or any particular lesson. Is that correct?
Some districts have that process, not every district.
Every parent can opt their
Every
child
parent can opt out. You're right on that. On a given, in a library, you can say, I don't want my child to check out this book.
So the difference would be that this bill would allow one parent who might have a specific agenda to opt every child out of reading some other material that they personally objected to. Is that correct?
So again, the only way that would happen is if they objected to the book and then the superintendent agreed with the parent's objection, which means that they agreed it was harmful to a minor. And again, I think we said, I don't think we want to put materials harmful to a minor in minors' hands.
So one parent could object to a book for an entire district and take the other parent's choice away. Is that correct?
Again, no, that's a mischaracterization. One parent can object to the book. You're absolutely right. But then an educator makes the determination on whether that meets the criteria necessary. Again, is that material harmful to a minor? An educator makes that decision. So it's the school deciding, yeah, this parent's right, or no, this parent's wrong. The school makes that decision, not the parent at all. The parent just makes the right to challenge. But the result of that challenge is completely within the hands of the educator.
Representative Woodcock?
Thank you. I was interested in Representative Perry's opportunity to pitch, but my concern comes the difference between local school boards, urban school boards, rural school boards. Clearly, a school board in a very rural area may have a different thinking than one in a very Concordish area. Okay. So I'm trying to, and I understand your desire, I think, of having one system for everyone. But I wonder why we would do that when we allow every local school board that understands their community and has representatives and educators from their community, let the local school board make the local decisions on what is inappropriate in their building or what film is appropriate versus making it one size fits all.
So again, a little bit misrepresentation. The definition is harmful to a minor, right? That's the definition. And we're not defining what that is. We're saying harmful to a minor and leaving it to the educator to decide whether or not that criteria is met. So again, and if they decide it's not, then the book doesn't get removed. If they decide it is, the book gets removed. Again, the educator, the superintendent makes the determination, not anybody else.
Just a clarification. Yeah, just clarification. Yeah, but the question, Senator Lang, is why wouldn't we allow local schools to make their own decision? Why do we have to have one size fits all in this process? The local school boards have been elected, hire a superintendent, hire teachers, and have, as Representative Selig said, have processes, have policies on complaints and all these things. I guess I'm concerned we continue to take things. One time we say, well, one size fits all, and then we say, oh, we can't have one size fits all. I just wonder why we don't allow something as close to important to a local community to let the local community handle it
If you can give me a case where a local community can decide to give pornography to a minor, I'll be happy to listen to that argument because I don't think there is one, right? And so this makes it clear that there isn't a case to do that.
You said this is process. We understand what a minority or what a minor is. We talked about the age issue and being age appropriate. But this is about process. Why? I'm not suggesting that, don't play those words. What I'm suggesting is the local community can make that decision, not what a minor is, but what is inappropriate. But you've taken that out of this. I just don't understand why you don't leave that in the local school board, that's all.
I don't know if I can answer it any clearer. This is a process bill that creates a process so all parents are treated the same across the entire state. So there's no differentiation between that. The definition and decision is made by the local school superintendent, not, so it is still local control. It's in their determination whether or not it meets the criteria.
No, it's not local control if you outline the process. Don't show the process there. Thank you.
Any other questions? Representative Balboni.
Thank you, Madam Chair. Just one clarification. You mentioned several times that it only is for material that is determined to be harmful to minors. I just want to address in lines 13 through 16, it actually says that they can bring complaints alleging that material is harmful to minors, age inappropriate, or otherwise offensive or inappropriate for use in the child's school. So it is more expansive than just the harmful to minors statute.
Right. Again, but I think any of those other categories are just as damaging.
Representative Hall? Thank you. Just a quick question. Thank you, Senator. Can you confirm that parents are treated differently in the process throughout the state?
I can tell you that not every school district has the same policy as it relates to how to challenge a book. So therefore, that in and of itself would mean that each parents in different districts are treated differently.
Thank you. Any other questions? Seeing none, thank you very much. And we will go to 3-minute testimony. Rachel?
Thank you so much, Madam Chair and members of the committee. My name is Rachel Potter, and I'm here as Policy Associate for the ACLU of New Hampshire to oppose this legislation. And really for a simple reason, because this legislation is a book ban. And banning books violates the First Amendment, threatens our democracy, and frankly is just not the New Hampshire way. Free access to ideas is foundational to a healthy democracy, and suppressing ideas prevents open debate and informed citizenship. This bill raises serious constitutional, educational, and just plain practical concerns, some of which were pointed out in the questions here before. This bill would be one of, if not the most expansive book ban in the country, allowing for removal of a host of classroom materials, as we've talked about, based on vague and subjective standards, such as what may be considered offensive or age inappropriate. Public schools are not spaces for ideological conformity. They're meant to prepare students for participation in a diverse and complex society, and that requires exposure to a wide range of viewpoints, including those that may challenge or expand a student's perspective. And the Supreme Court has recognized that students don't shed their First Amendment rights at the schoolhouse gate, and that includes the right to receive information. And SB 434 raises particularly serious concerns because it invites viewpoint discrimination. Across the country, similar laws have disproportionately resulted in the removal of materials that address race, religion, different religious texts, gender, LGBTQ plus identities, and other historically marginalized perspectives. When a law enables the removal of materials based on disagreement with their content or viewpoint, it crosses that constitutional line. And this bill is also just plainly unnecessary. As we've talked about, schools already have processes in place for parents to raise concerns about materials and for parents to opt out of any materials and for their families to make decisions for their own children without restricting access for somebody else's children. SB 434 goes far beyond that. It allows one person to limit what all students can learn. And that's not parental choice. That's a person's preference becoming a rule for everyone. And that preference can go any way that the cultural tide turns. And that's not the live free or die spirit.
And this creates a chilling effect in classrooms. The result is not better education, it is less honest, less rigorous, and less effective education. The vague standards in this bill will lead to inconsistent application across districts, as we've kind of explored in the questions before this, and invite costly legal challenges. And not to mention the wide breadth of materials potentially covered by this legislation will make it nearly impossible for local districts to manage. Courts have repeatedly scrutinized these laws that restrict access to ideas in schools, particularly when they are vague and enable viewpoint-based removal. And so for those reasons, we ask you to oppose it.
Thank you. Are there any questions? Representative Woodcock.
Thank you. Welcome back, Attorney. Can you define, Representative Balboni brought this up and I don't see a definition. I'm looking at the bill, I don't know if you have a copy in front of you. On line 15, what is otherwise offensive? How do you define that?
I don't have a copy of the bill in front of me, but I know that otherwise offensive is a term that we would consider very vague and a subjective standard. And so that's what creates a lot of the constitutional concern with this law.
Okay, thank you. Thank you, Madam Chair.
Any other questions? Representative Okay, Representative Cornell.
Thank you. Thank you. I know that Governor Ayotte vetoed this and that this is in response to trying to make it less vague. Do you see anything in this bill that would make it more likely to get past the veto than the other one?
I can't speak to how the governor is going to react to this bill, but I will say that we view the bill as unconstitutional, as one of the most, if not the most expansive book ban in the country. So we will let her know that.
Thank you.
Representative Freeman.
Thank you, Madam Chair, and thank you for taking my questions. I'm going to ask you the same question I asked Senator Lang. If I, as an adult, were to provide a minor child who's not related to me by blood or relation with pornography, what might the legal ramifications be?
I'm not seeing how that is related to this specific legislation. So
you don't have an answer for my question.
Rephrase it, I guess.
Pretty simple. What would happen to me? What would happen to me as an adult if I provided pornographic material to a minor child who's not related to me by blood or relation? What would happen to me?
Again, I'm not seeing how that's related to this book banning bill.
Thank you.
Would you believe that there's actually pornography in the public school libraries?
I haven't been to every public school library, but I know that there are processes in place.
I have a really good sample right here, and it is pornography.
So there are processes.
No, a child does not have a right.
Point of order.
No.
I'm going to finish. A child doesn't have a right to read pornography. Are there any other questions? Representative Selig.
Thank you for taking my question. Sure. So I'm looking at the section where it talks about pamphlets, phonographic records. Sorry, I have to, after the last conversation, reread that. Pictures, drawings, photographs, figures, statues, et cetera, et cetera, et cetera. So I think about the art classes that are taught in our schools, which include teaching people how to draw people, where they use those like little wooden thingies and other kinds of things, and they don't bring people in to, stand there unclothed as they might in a college setting. But they also do take kids to museums where they would see perhaps the statue of David. Is the way this law is written, does this mean that I wouldn't, as a teacher, I'd be subject to risk for taking my children to a museum? And maybe I'm taking them to see something else, but there happens to be nudes in the museum? Is that...
I would say
teacher putting me at risk?
Sorry to interrupt you. Yeah, I would say that it's vague enough that we would be concerned for the chilling effect that it would have on teachers. I can't speak to that specific scenario because it is so vague. But yes, the bill encompasses a wide variety of materials beyond books, as we talked about, performances, art, and so just the mere, enforcement aspect itself is just nearly impossible and impractical.
Thank you. Any other questions? Representative Litchfield?
Thank you, Madam Chair, and thank you for taking my question.
Sure.
You've mentioned several times the phrase book banning, and I wanted to ask you, I've gone through it a couple times, where in this bill do you see language that would result in banning books rather than establishing a review process?
Sure. So this bill would, for the third year in a row, provide avenues for banning books that are fundamentally unconstitutional and a violation of our First Amendment rights and students' freedom to read. Would be my response to that.
So,
Representative Terry?
so you would have, with respect to Representative Litchfield's question, so you would have an issue with a decision made by a superintendent and a school board to uphold a parent's objection with respect to content. You would have an objection to that process and those parties involved making a local decision somewhat consistent with the Supreme Court's rulings about community standards?
So the way that the bill is written is so vague, and school districts already have processes in place. Parents can already opt their children out of any materials. So,
Excuse me, that's not my question. My question is, you would object to a superintendent and a school board making a decision?
the way that this bill is worded, yes. The process that this bill lays out.
Any other questions? Representative Selig?
Thank you. If a school board and a superintendent determined a book was not appropriate for their community and withdrew it because the school board and the superintendent decided it was inappropriate, regardless of this bill, that would be totally fine, correct?
I mean, I think it's a case-by-case basis as far as if you're talking about a specific case, but the processes that are already in place, this is happening and it already happens, and this specific legislation is what I'm here to oppose today, not a hypothetical.
Any other questions? Representative McDonald.
Thank you, Madam Chair, and thank you for being here again. I know we've discussed this at length in other proceedings. I am curious, you referenced that there are policies in place in some districts. Do you have an example of a model policy that's working?
I do not at the moment. I defer to some other folks here that might be testifying and might have more to say on that, but yeah.
Any other questions? Seeing none, thank you very much.
Thank you.
David Trumbull? That would be better as well. Pay attention. No, can
Thank you, Madam Chairwoman and committee members. I'm David Trumbull from the town of Ware, and I oppose this bill. Essentially, we have two options. The status quo right now, every school district has some sort of process to deal with complaints, and a parent who's not satisfied can opt their children out. This bill replaces the I will opt my child out with I will opt out the whole classroom and the whole school if I object to issues. To try and answer some of the questions, is there a model bill? I believe there is. The American Library Association has processes for these sorts of complaints. There was a bill, in fact, proposed in the legislature to use the American Library Association model. That would have been a pure process bill. It would have said, here's how we do it. This bill is not a pure process bill. It's a content bill. It takes the phrase harmful to minors, but then it becomes a change in content when it adds the other criteria, the otherwise offensive or inappropriate. Those are vague terms. How do you determine what is otherwise offensive or inappropriate? This bill does change the results that would be made by school boards, to answer Representative Terry's questions, because it now expands what can be banned from simply what is harmful to a minor to anything that's offensive or inappropriate. to go back to the First Amendment issue, I'd like to just go back to that U.S. Supreme Court case, Board of Education versus PICO. They said the First Amendment applies to the school setting. And they said the Constitution protects the right to receive information and ideas. The right of freedom of speech and press embraces the right to distribute literature and necessarily protects the right to receive it. The children in the schools have the right under the First Amendment to receive information. And if we deny them that, then we are not doing our job to properly educate them. And one example that comes to mind is that 75% of books that are sought to be banned involve the character who is either a person of color or LGBTQ. So take an example of a book where there's a character who has parents who are in a same-sex marriage. Some people will find that otherwise offensive or inappropriate, and they will complain to the school board. Other people who may be legally, constitutionally protected married as same-sex couples will say, well, that's not otherwise appropriate and offensive, that's my family. But this bill would allow banning those books, and that's 75% of the book bans in this country. So I don't think we should allow one family to censor books for other people. This is not a process bill, it's a content bill. It expands the cases in which books can be banned. I think the status quo is a lot better. Every single school board has got some sort of process to deal with it right now. They do it, they make sure there aren't books harmful to minors. We should not expand that to include books that one family might find offensive or inappropriate. I think that's all I have. Thank you.
Thank you. Are there any questions? Representative Freeman?
Thank you, Madam Chair, and thank you for taking my question. So I'm curious, do you have a list of those 75% books that have been banned? I'd like to see that list.
So that research is from, I believe, I didn't bring my whole file with me, but I think it's from the American Library. Oh, no, wait a minute. There's a group that does a report every year on the books that have been banned. And that's the statistic. 75% of books, it's either a character who's a person of color or LGBTQ. Those are the books that are constantly brought forward for book bans.
Follow up? Thank you. I'd really like to be supplied with that reference. I'd like to see what that 75% of books that are banned is. I think that's important for us to have context on what we're looking at. May I have a follow-up, Madam Chair?
Sure.
Thank you. And you also referenced books that were banned, and I'm pretty sure you said 75% of them had content with people of color. Is that correct?
No,
I'm getting that wrong?
Okay, thank you for the question, Representative Freeman. What I said was that 75% of books that are sought to be banned involve the character who is either a person of color or LGBTQ.
Okay, if I could get that, I would be much appreciative.
I bet you before we get 5 minutes past this, somebody will have Googled it and be able to tell you the name of it. I'm embarrassed. I don't remember. It's a group that studies libraries. It's been at it for 100 years. They've been doing this.
I'm a patient individual, sir. If you can get that to me at a later date, again, I'd be much appreciative.
Absolutely. I'll do that, Representative Freeman.
Any other questions? Representative Litchfield?
Thank you, Madam Chair. Thank you for taking my question. Can you please just help me understand what you're saying when you say, what is your definition of banned? Because I'm wondering if we're talking about books that may have been challenged due to inappropriate or objectionable material within the book, or outright banned. And when you say banned, what does that mean? Like, do you mean banned across the state? Do you mean banned within a local preschool? Like, where does this come from?
I think that this bill creates it does two things. It creates a uniform process for these cases around the state. And then what it does is it expands the criteria under which a book or any of these other materials, plays, and so forth, can be banned in a school or in a school district.
Excuse me, I'm sorry. I meant to, maybe you misunderstood. I was basing it on the statistics that you just gave, not the interpretation of the bill.
Oh, okay. I'm sorry. I will send to both of you. I'll send it to the whole committee. It's sitting in front of my mind. I can see it. But anyways, there's a group that defends freedom of the press, and they've been looking at book bans for over 100 years, and they do a report every year. And this is the general statistic, is that 3 out of 4 times when there's a book or something to be banned, it involves characters who are either people of color or LGBTQ. That's in recent years, obviously.
Follow-up?
Yes, I would like to ask you to please take it a step further in your research. Understand what you're saying about LGBTQ characters, and that would not be okay. I would like to just have it clarified in these books. Are there discussion of different sexual situations, and are they graphic, and are there pictures? Thank you.
I understand your question, and this goes to the age appropriate and graphic sex, and the definition of harmful to minors refers to this other statute, which it's 571B11, which lists three things: sexual conduct, but also this other section called lacks serious literary, artistic, political, or scientific value. Those cases, when they go to court, look at these books or materials when taken as a whole. So even if we use this standard, okay, there will be books that, taken as a whole, will be deemed to have literary or artistic value, although they may have a section in them that would be offensive. And so that would be under the definition that Senator Lang used. He said, we'll use harmful to minors. It's been around for 60 years. That language has been used at the federal level, U.S. Supreme Court. And it references this section, this harmful to minors, says sexual conduct or lacks serious literary, artistic, political, or scientific value. If you Google lacks literary, scientific, artistic value, it'll say those cases, when the courts look at them, they look at the book as a whole. And so even though there may be sections in there that would be offensive, the book would still have artistic, whole literary value. Classic books sometimes have sections that might be. So I guess what I'm saying is then that's up for a school board to determine that book maybe belongs in the high school library, but not in the middle school library. We have a process for that right now. We don't need a bill that expands the categories of cases that can be banned to anything that's offensive or inappropriate, because that's not defined. Senator Lang said, my bill is just a process bill. I'm using a definition that's in another statute, a definition we've had for 60 years. And then he was asked, well, what about the fact that your bill expands it to not just use that definition, but be anything that's offensive or inappropriate? And he says, oh, I'm going to get it right. He was asked that question. He said, I think those things are bad too. Essentially, I was taking notes on how he answered that question.
Any other questions, Representative Terry?
Yes. With respect to your stated objection to the expansion of the number of categories under which a parent can object, is there really any difference in the final analysis as to who makes the decision, the superintendent and ultimately the school board? So that, to be real clear about this, a school board could say, we don't believe that this book is otherwise offensive. We don't believe that this is otherwise inappropriate, even though it might be an expansion of the categories. Nevertheless, it is the school board that decides what materials are going to be made available and what materials are not going to be made available. So what's the issue?
That's exactly the reason why so many of us are here objecting to this bill. You seem to be in favor of letting the school board make that decision. And I would agree with you. Let the school board make that decision. We trust them to make that decision now. Every school board in the state has a way of dealing with this right now. So they have criteria. They go through it. That's fine. If you want just a process bill, if you want to have the same process, the same number, you complain to this person, you appeal to that person, you have so many days to do it, then make that the bill, right? Take out all of this expansion of what can be banned in this bill. If you just want a process bill, then just do a process bill. This bill is a process bill that's uniform, plus it expands what can be banned, and that's where the objection lies.
So you would be happy with every school board making its own decision as to what its policy is going to be and what materials are going to would be considered as categories under which a material might be removed, as opposed to a universal list of possibilities that ultimately the school board is going to decide whether they agree or don't agree.
I don't have a disagreement with.
Is it that? It's you don't want a statewide definition of the list? Because you're not, it seems to me you're not objecting to the process. I'm not hearing that so much as it is, you're objecting to the list. And you want the school boards to have the freedom to be able to decide their own lists rather than to have a universal list from which to choose.
Thank you. So, yes, a couple things. Thank you for the question. So, as far as process goes, I'm not opposed to a uniform process. As I said, the American Library Association has a model that they've proposed. I remember hearing testimony from the Dover School Board about this, that they had a bill and they went through this process and they created a process which they are now offering to other school boards in the state as a model. So I think it's a good idea to have a model because this is something the school boards, they have a lot of other things that they have to deal with. So a fine process, I think we're in rough agreement. As far as what should be the decision-making factors, what they should use to decide, I think that should be largely within local control. But this bill goes beyond that and it expands what can be banned to anything that's offensive or inappropriate. That's just so broad that it's hard to imagine something that many people would find things offensive or inappropriate. I gave the example of a book where it's about a child, and it's a children's book, okay? The child has two parents, they're same-sex parents. That's a constitutional right. But some people are going to say, that's offensive. I don't want that book, my child reading that book. Right now, they can opt their child out of that lesson. But I don't think we should take that book out of the school library. We shouldn't take it so that we just dismiss that as an idea that we're willing to discuss.
So I appreciate your opinion, and I appreciate there are different points of view as to what ought to be available and what ought not to be available. But in the final analysis, it becomes every school board, beyond the superintendent, if there's an appeal of a decision that is made by a superintendent that the parent doesn't like. Ultimately, it's the school board that decides whether or not material is going to continue to be made available or not be made available. And it doesn't matter whether the list has 3 items on it or 3,000. To be extreme here, the school board decides. And if the parent doesn't approve or doesn't like the decision, then the parent has other recourses, such as I withdraw my student from the school, or I decide I'm going to run a slate of candidates to the school board who agree with my opinion, and maybe we win or maybe we don't, which is America, right?
Right.
So it's the school board that decides.
Okay, thank you, Representative Terry. I appreciate where you're coming from. You're saying ultimately the school board's going to decide whether or not the list of things they can use is either just harmful to minors or harmful to minors and otherwise offensive or inappropriate. Either way, the school board's going to make the same decision. So why do we care if it's in the bill or not? Is that essentially what you're saying?
I'm trying to drill down on how it is that you're objecting to an expansive list of possibilities from which a school board chooses, because a school board doesn't have to make a decision that may be in agreement with the parent's point of view. The school board could, in extremis here, the school board can say, we've got all kinds of pornographic material in the school. We don't consider it pornographic. We've got all kinds of material here that that this parent objects to, but we don't believe that it's harmful at all. We believe it's beneficial to students, and so that's the decision of our school board until some other group makes a decision to the contrary.
I understand where you're going. So I would look at it this way. It's like concentric circles. The core circle is harmful to minors. Okay, those are the books that right now they're banning and they would continue under this. This bill expands that concentric circle out wider and now includes offensive or inappropriate. And you're saying, well, who cares because the school board's going to either rule one way or the other anyway. And what I would say is that, go back to the First Amendment, there is inherent value in children learning and having open schools where children can be educated. They have a First Amendment right to receive information. So if we have a law on the books that says a school district could ban books just because somebody thinks it's offensive, I think that goes against the First Amendment. So I don't think that should be in the law. If we both could agree that something that somebody might find offensive, even if it's a constitutional right, but somebody would ban that, that's bad. So I would say let's not put bad things into law. If you want to go to that narrow concentric circle of things that you find very offensive or harmful to minors under that statute, that's one thing. But when you expand it out to something that anybody might find offensive or inappropriate, we're now potentially making it legal to ban something that somebody just might find offensive. That's taking away the First Amendment rights of everybody else in that school. I don't know if I've answered it, but I appreciate it.
You've answered the question, and that's why you're here. Thank you.
Thank you.
Representative Woodcock?
Hey, Mr. Trumbull, I think the organization you were looking for was PEN America.
That's it. Thank you very much, Representative Woodcock. PEN America.
Poets, essayists, and novelists.
Representative Selly?
Thank you, and thank you for taking my question. I'm thinking one of the many bills, and I don't remember where this one is in process, would have us consolidate so we have one superintendent per county. But that doesn't change the school districts and school boards that are local. So if I have one superintendent per county, and I'm in this town with my school board here that reports up, or I don't even know how that's all going to work, but which school board do I appeal to? If I disagree with my superintendent, do I appeal just to my school board, or do I appeal to the other school boards he also reports to? And what if the two different school boards disagree? And
It's kind of an extreme hypothetical. That bill is no longer.
did we kill that bill? I'm sorry.
Yes.
Okay, well then I was just trying to figure out.
Mercifully.
Okay, then I withdraw my question. I just was thinking about that bill and how would that possibly work with all of this? So, okay, well, I guess it's another reason it's good we killed that bill.
Any other questions? Seeing none, thank you very much.
Thank you.
I was going to start drinking.
Okay, this next one, it's either
Teetotal alcoholic with
Willow or Wilbur. Willow, okay. That's right the first time.
I'm sorry.
Honorable members of the committee, my name is Willow Earth. I live in Derry and I oppose this bill. What books should and should not be read by children should be the decision of the guardians and the educators. Is this really the live free or die state if any one individual can censor books out of personal grievance? We should be focused on raising kids to think critically, not restricting their access to educational knowledge. Please vote against this bill. Thank you.
Thank you. Do you want to take any questions?
Sure.
Are there any questions? Representative Woodcock.
I don't have a question. That's what he's been sitting here all morning. Thank him for that one line, waiting 3 hours to say that. Thank you.
Okay, thank you very much.
Thanks.
Jacqueline Benson?
I had written down good morning in my testimony here, so good afternoon, members of the committee. My name is Jacqueline Benson. I'm the New Hampshire Regional Leader for Authors Against Book Bans. So I'm here representing about 36 authors, editors, and illustrators resident here in New Hampshire who share deep concerns about this legislation. Senator Ling described this as a process bill, but we already have a process in place for addressing the provision of harmful material to minors. That's RSA 571. We already have a process in place for parental objections to their specific children being exposed to material that they otherwise, for potentially very broad reasons, find offensive or disagree with. That's RSA 189. So there's a question to me about what the value of this bill is with those processes already in place. As some of the other speakers have pointed out, what this bill does that goes beyond that other legislation is it broadly expands the books that can be banned using this otherwise offensive or inappropriate language. And what I wanted to kind of make sure the committee is aware of here, Authors Against Book Bans, several of our members outside of New Hampshire, well, and one of them is actually a prominent New Hampshire author, are involved in lawsuits that have been brought against bills with similarly broad definitions for the books that can be removed under their legislation. There's a case in Florida right now that has already had one ruling in favor of the plaintiffs where they have said that this law is unconstitutional. That's currently being appealed. There's a case in, let me see, there's the Iowa case. That one is now under injunction. There's another one in Idaho. In Utah, there is a lawsuit that just got filed because a book was removed from the state. So in Utah, under their law, if a book is banned in 3 schools, it gets taken out of all state schools. And a book from written by Kurt Vonnegut was removed. And so Vonnegut's estate is suing. So even dead authors can sue you over this stuff. And this was one of the points that Governor Ayotte made in her veto of HB 324, is that as this law is written, and as some of the other speakers have pointed out, you are potentially running afoul of constitutional protections for freedom of speech and exposing the state of New Hampshire to legal action. Some of the parties involved in these lawsuits, beyond the authors, you have the big publishers like Penguin Random House and Macmillan. These guys have deep pockets. You're looking at very expensive liability for the state. As Mr. Turnbull pointed out, there is other legislation, there's other model legislation that the state could consider if we want to address this at the state level and not at the local level where it's currently being addressed. The American Library Association recommendations on this are much more constitutionally robust. There's still a strong vehicle for concerned parents to raise issues about books that they are worried about, but you would be more protected from that potential liability.
Thank you. Are there any questions? Representative Dry.
Thank you. Thank you, and thank you for taking my question. Daughter of librarian.
Hi.
I don't know what your idea of band is. Mine, I think, is larger than yours.
Okay.
Okay, as in band is not available. That's it. And I don't see where these books are not available otherwise if they're removed from a particular library.
So your argument would be if they're taken out of the library, they're not banned because potentially somebody could just go buy the book at a bookstore, for example.
That is correct. Thank you.
I would counter that with the point that our libraries are established so that knowledge, information, and stories are available to everyone in our communities, regardless of their ability to go to a bookstore and pay for books that they can't otherwise find. So in removing books from the library, you are eliminating access for certain groups of people that may not otherwise have the resources to go and buy these books elsewhere.
Representative Litchfield?
Thank you. And thank you for taking my question. This book that is not allowed in what began as 3 schools in Utah, are you aware of what the book is?
It was a Vonnegut title. I don't remember which one off the top of my head.
I didn't mean it. Sorry, it's not a trick question. It's Slaughterhouse 5.
Okay.
And when I'm looking it up, I just wanted to get more information about the controversy. But did you know that the controversy surrounding the book stems from graphic depictions of war, themes of fatalism, and the inclusion of strong language and sexual content?
Yes.
Which is why it's been challenged. So would that not lead us back to the age appropriateness?
I think the issue and the reason that the Vonnegut estate is raising this lawsuit in Utah is that this book was being removed even from collections where it could be considered age appropriate. I think Slaughterhouse 5 arguably is a piece of literature that has educational value for certain levels of students within our public schools. So I think that's where the issue came in.
Representative Terry.
You mentioned states where laws have been enacted and plaintiffs have succeeded in court.
Yes.
I believe you also mentioned that there are other states that have statutes that are not as constitutionally vulnerable. Mm-hmm. Could you share those? Could you tell us where those states who they are?
I don't have a list off the top of my head. I know they talked about, I think Rhode Island passed some legislation this year. I know they were working on something in Maine. I think New Jersey's law might be another one that was modeled after the American Library Association formula. I'm happy to provide that information to the committee if it would be helpful. It's something I could email out to you guys tomorrow if it would be useful while you're discussing this legislation.
Sure.
Awesome. Okay. I'm happy to do that.
Any other questions?
Seeing none, thank you very much.
Thank you.
Aubrey Friedman.
Madam Chair, committee members, Aubrey Friedman, live in Bridgewater, speak in support of this bill. I want to concentrate on two specific incidents regarding this issue. And I totally support having a policy in place for parents to challenge books. So this was in the Newfound, a rural district. So that will be relevant in a second. So we had in 2022, there was a big, they got a new curriculum and there was some iffy stuff in there. And some parents or taxpayers noticed, and I've got examples in the backup that I'll pass out. Anyway, it was a big controversy and it was actually a big embarrassment for this school district. They didn't vet the books properly. So in the end, they formed a curriculum committee to study this stuff. And actually parents, and I was one of our taxpayers, we went through all like grades, and we're talking like, this was elementary school. There was really some with sexual overtones. So we went through all the books ourselves, actually all the curriculum, the math, the English and everything. Okay, then a couple years later, we had the situation with the typical, books that are banned, the 10 most banned, the library book culture war issue. And here's how it worked out in Newfound. They have a policy which is rather similar to what's being proposed in this bill. The form was filled out to challenge the book, goes to the superintendent. He formed a committee with teachers and they had they read the books, studied them, and rendered their decision that the books were okay. These are not harmful and whatever. And then the taxpayers who complained, they challenged that. We don't accept this verdict. So I went to the school board. The school board had a very robust discussion, I can tell you. Think about how most school boards lean which way politically. And so it was a 5-2 type of mix, and that was the decision. But it was a very robust discussion. In the end, the school board voted to, the books are okay, they're going to stay here. So it had a hearing. The liberal people on the liberal side were happy. It's freedom of speech, it's the First Amendment, all this stuff. The conservative people, they obviously weren't happy, but it went through the process. And there was as I say, a robust discussion. And as it turns out afterwards, the books did go back into the library, but they were not displaying them. They're kind of like, if you have to ask for them, but they'll be there. So it was kind of, I think it was a good way to handle it because it's a culture war issue and there's no way you're going to have everybody happy. And having the process play out, I think, worked out quite well. And even the conservative people in the end said, well, at least they're not displaying them and, we brought the issue. Okay. And I support it. Thank you.
Are there any questions? Representative Woodcock.
Thank you. Mr. Friedman, good to see you again. If local school boards already have a current policy that works with community standards and community members, and as you were indicating in your example you just gave, and there's a resolution, whichever way it happens to be, what's wrong with that?
Well, that particular one worked, I think, pretty fair for everybody, but I don't know that every school district has that. Actually,
they all have policies on that.
Well, I looked at my own policy for my school district, where I'm in Pasquaney now, and it actually says for, specific course material. So that to me is more about curriculum, to be honest. It's not the library books and the culture war stuff. So it doesn't really cover that. And this bill does. This is more broad. In a way, it's better. And it really does say specific course material. So then it to me is not broad enough.
Okay, thank you. Thank you, Madam Chair.
Any other questions? Seeing none, thank you very much.
Thank you.
Sarah Terrell?
She said she had to leave and she left her testimony. It's written testimony, it's been distributed, but she had to leave.
Okay.
Is this?
Griseliz Glenn?
It's Griselli.
Oh, thank
My name's Griselli. I'm from Manchester, and I'm a parent, and I'm here in opposition to this bill. The bill's being framed, to me, it's being framed as some type of parental right that we have, but the language does not appear in that text. What this bill creates is not a right, it's a mechanism, and that distinction makes a difference. This bill establishes a formal, multi-step complaint and review process that allows materials in schools, including books, lessons, displays, guest speakers, to be challenged, investigated, escalated to the school board, and entered into the public record. It also imports the definition of harmful to minors from RSA 5571B1, a statute specifically designed to address explicit sexual material under a narrow legal standard. That standard requires that material meet multiple criteria, including appealing to prudent interest and lacking serious value. This bill does not apply that definition narrowly. It extends it across the full scope of educational materials, while also introducing undefined and subjective terms such as age inappropriate and otherwise offensive. That combination does not create clarity. It creates interpretation. And when interpretation is placed inside a formal process that requires investigation, response, escalation, and public documentation, it does more than allow complaints. It increases their impact. This bill makes it easy for a single complaint to trigger a structured chain of action. And that raises a fundamental question, because it is notably easy in this context to create a system where a complaint results in a mandatory review, escalation, and a public accountability. And yet, we do not see the same level of urgency to establish equally structured enforceable mechanisms when it comes to reviewing the conduct of those who hold actual authority and power over others. Here, the threshold is low, the process is defined, and the response is required. In other contexts, the same clarity and enforceability is far less common. That contrast is not insignificant. Within schools, the outcome of this structure is predictable. When decision-making is tied to the formal complaint process with escalation and public exposure, the pressure is not toward inclusion, it is toward avoidance. Material is evaluated not only on its value, but on its vulnerability to challenge. As a parent, I do not want my child's education shaped by a system that lowers that threshold for the other restrictions while broadening the scope of what can be challenged. I do not want a legal standard that's designed for a completely different bill for explicit sexual material extended to a general education decision-making. And I do not want access to information narrowed through a process that rewards the persistence over expertise. Public education exists within a diverse society. It cannot function if the standard becomes whatever is least likely to be challenged. That is not protection, that is limitation. This bill does not create balance. It creates a mechanism that shifts control, expands pressure, and narrows access. And for these reasons, I respectfully urge you to oppose this bill. Thank you.
Are there any questions?
And I just wanted to, it was Penn America, he was right. And I just wanted to read this statistics that it says here. It says, during the 2023-2024 school year, 36% of all banned titles featured characters or people of color, and a quarter of them included LGBTQ people or characters. Erasure of identities is even clearer with certain types of books. 73% of all graphic and illustrated titles feature LGBTQ and representation people or characters of color, or discuss race or racism. And for all the inflammatory rhetoric about explicit books, only 13% of banned titles had on the page descriptions of sexual experiences. Thank you.
Thank you. Any questions?
Representative Selig?
Thank you so much. If you, when you have an opportunity later to just send us the link that you just read, that would be fantastic. Thank you.
Thank you very much.
Thank you.
Barrett Christina?
Thank you, Madam Chair. Good afternoon, members of the committee. Barrett Christina, New Hampshire School Boards Association. We are opposed to House Senate Bill 434. I do want to be clear, though, just as NHSBA has said with the multitude of other bills that have come across this committee the last 3 or 4 years, we don't oppose a bill requiring school boards to have a policy about reconsideration of instructional or materials that are in the library or otherwise available. We oppose primarily to the prescriptive nature of this bill. We've heard time and time again that it's a process bill, I'll note that over the number of bills that we've had, again, in both chambers the last 3 or 4 years, people who have wanted these sorts of bills have not come complaining about process. They've come complaining about the sorts of types of materials, about whether or not it's inappropriate, pornographic, age appropriate, age inappropriate. That's been the concern of the people that have come in favor of these bills the last number of years, not process. Also, the last number of years, we've had challenges in New Hampshire schools. Concord Monitor, December 2nd, 2025, Merrimack Valley School recommends removal of book from English class. Union Leader, March 22nd, 2023, Bow High School rejects parental challenges to a novel. NH Public Radio, November 3rd, 2023, Dover School Board unanimously rejects effort to ban a particular book from the library. Also important to note, the Dover challenge initially included 8 books that were specifically challenged. When I get to the bill a little bit earlier, we talk about some of the timelines. Challenging 8 books all at once may not be reasonable within the 25-day timeline that we have in the bill. An article from the School Library Journal of October 2010, New Hampshire parent challenges the Hunger Games, that came out of Goffstown. The Patch, which I guess is sort of a newspapery website, March 2024, 18 titles challenged in book bans in New Hampshire between 2020 and 23. There were challenges to certain books in Litchfield in 2009. There was a challenge to a book in Bedford in fall of 2021. The processes that we have seem to be working in these particular communities. We don't need a bill establishing a unified process statewide when the processes are working in these communities that have been reported on where these challenges have been coming. Other aspects relative to the bill itself. There were discussions earlier about the definition of material. We agree that it's rather broad. And if you look at the broad definition of material in the bill, but then look at the rest of the statute about the complaint process and the review process, this is talking about dances or other representations perhaps performed by guests or speakers. So you have a guest speaker who does his or her best Elvis impression, shakes his hips, somebody in the audience finds that offensive, complains to the superintendent or the school board. We have to go through a process to remove that material from the school. As the bill says, that part doesn't make any sense. We think narrowing the definition to books, materials, pamphlets, magazines, movies, whatnot, we think would be more appropriate. Continuing on, I'm on page 1, line 15, where it says the material is harmful to minors, age appropriate. I'm going to focus on that. The educational term.
You'll need to wrap up because your time is up.
Okay, certainly. One last quick point about age appropriate, if that'd be all right. The Department of Education in their DOE rules 306.08 uses the phrase developmentally appropriate. The local school board shall require that each school provides a developmentally appropriate collection of resources aligned in all learning and grade levels, including online and print materials, equipment, technology, so on and so forth. So developmentally appropriate would be consistent with the minimum standards that were recently adopted by the State Board of Education. And that phrase is used maybe 2 or 3 other times, and it's actually specifically defined in the minimum standards as well too. Thank you, Madam Chair. I know I was had to limit the time period, but I'm happy to answer any questions if anybody has any.
Thank you. Representative Cornell. Thank you.
Thank you, Madam Chair. Thank you for taking my question. You mentioned a number of places that there had been requests to look at books. So, and they were all different places. Are there many school districts in New Hampshire that do not have a policy in place?
Thank you for the question, Representative. We don't track what school boards have what policies. We have 160 members that are, members of NHSBA. We can't track, each school board may have 200 or 300 policies. We can't track that. However, I will say that, I forget if it was last year, all these bills kind of run together. I think it may have been 2 sessions ago when we had a bill seeking to limit or at least allow a process for parents to raise concerns about the materials in the school. I think there were 20 people on House at that time, and I went through each of the members on the board, and I found you remember, Representative, I found the policies from I think about 15 or 16 of the high schools that were representative on when it was just House Ed policy back a session or 2 sessions ago when I did that. So I think at this point, most school districts that at least have a high school will have a policy on reconsideration of certain materials. If you're a K through 6 school district, maybe you're not. Maybe it's more of an informal process. There may be a policy, but it's not going to be filled with deadlines and things of that nature.
Representative Woodcock.
Yeah, sure. Thank you, Attorney Christina, for taking a couple questions. When you just mentioned a moment ago about DOE and being developmentally appropriate versus inappropriate, age inappropriate, was that our DOE here or is that federal?
No, that's the New Hampshire Department of Education. Again, it's in the 306 rules.
Okay.
The first one was ED Department of Education Rule 306.08. And then there's a definition, if I can find it as well, too. This is 306.01 K as in kangaroo. There's a definition. Developmentally appropriate means activities, materials, and environments that are suitable for a person's age, level of maturity, and stage of development, including cognitive, emotional, social, and physical abilities. Again, 306.01 K.
Wrote it down. Thank you.
Yeah.
Just a follow-up, Madam Chair? Sure. Thank you. I asked a couple of times, I haven't got clarity. Hopefully you can give it to me. What does otherwise offensive mean?
Yeah, it's a subjective standard. You're not going to be able to, to some degree, it's sort of, what does reasonableness mean? Well, reasonableness means what 12 people on a jury decide it means in terms of behavior. So, what one person may find objectionable, another person may not find objectionable. That's why we have that provision. I think it's in RSA 186.11 that allows for parents to opt their children out of course material. This is, we're talking more about library material for this bill, but course material that the parents find objectionable, and that's a subjective standard based on whatever the parents believe it to be.
Okay, thank you. Thank you, Madam Chair.
Representative Selig.
Thank you, and thank you for taking my question. You referenced that in Dover, for example, someone had challenged 8 books simultaneously, and in some of the other districts, I started losing track of the numbers, both long day and reason why I taught English and not math. But if we have, let's say, 3 different parents that each decide to challenge 20 books in September, how is the superintendent, or how do you see that working the way this bill is written, with the superintendent being able to investigate all, I've lost track of how many books I've gotten to at this point.
60.
Okay, thank you. See, it's a good thing you're paying attention. And manage that as well as their, superintendent job.
Right. So thank you for the question, Representative. It's not in the bill, but I'll tell you anecdotally, in some or many of the school districts where these challenges have arisen, the board has or maybe the superintendent has constituted a committee where you'll have maybe, let's say the book is in the middle school. You may have a middle school teacher, a high school teacher, a board member or 2, the building level principal. I've heard, not in New Hampshire, but I've heard read articles nationwide where the board or the administration will invite in like a child psychologist to offer their opinion on whether or not it's age or developmentally appropriate. So, the timeline that's in the bill, notify parents within 10 days of receipt of the complaint, within 25 days of notice of receipt, or otherwise agreed by the parties. They make a determination within 5 days, you let the parents know. Yeah, if it's one or two books that are being challenged, I think the timeline is generally workable. But 8 books, asking people, who reads 8 books in a year, let alone 8 books in a month? I'm just saying, some of us do and some of us don't. And it's not just reading the book, it's not, if you're reading it for the purpose of making a recommendation to a school board or an administration, you're not just reading it for pleasure, you're reading it to do some in-depth analysis or really contemplate, is this okay for 7th graders or should we move it up to the high school? Is this okay? Not at all in any school. So that's our concern with sort of the tight timeline. I understand, it says, or otherwise agreed upon by both parties. And Senator Lang touched down on that a little bit. He said, well, if the parent agrees to extend the deadline, all was well and good. Well, there's a second half to that equation as well, too, that remains unanswered.
Follow-up? Thank you, and thank you for taking my follow-up. With books that may or may not be challenged, would you see, based on the way this bill is written, is there a distinction between books that are used within a classroom for the purposes of instruction versus books that are in a library, especially like if you think of a K-8 school where you might have the library sectioned out for early readers versus middle readers, et cetera. Is there anything in this bill that's going to make a distinction so that something that, might not be, like I probably wouldn't give Fahrenheit 451 to my kindergartners, but I certainly use it at my high school level. Is there anything that distinguishes that in a library setting in this bill, or is it just subject to the exact same policy?
Thank you for the question, Representative. As I'm reading this, I think it would be inclusive of materials that are in the classroom for instructional purposes, and as well as materials that are in the library that are not part of curriculum or instruction, but rather the students could take out. And I'm looking at the definition of material means, so on and so forth, line 9, that are provided by the school district. I think that broad enough, or to not broad enough, but it would also encompass curricular material and additional resources that are found in the library. Thank you.
Representative Dry?
Thank you. Thank you for taking my question. Do you have a problem with the expansive list that defines materials?
I'm sorry, Representative, the list that defines materials.
The definition in this.
It's a little, the figure, statues, dances, and representations. Seems a little peculiar. And also, employees, obviously, volunteers, sure, the guests or speakers, I don't think is necessary because, again, the remainder of the bill talks about a process to remove the material from the school. If it's a guest speaker that is inappropriate for whatever reason, curses, gives the finger, whatever the case may be, we're not going to let that person back in the school again. I don't think we need to go to a process of 25 days and notify the parents if it's that blatantly, inappropriate. And that was, that may be, I don't like going down the road of, we can all think of crazy hypotheticals, right? And we don't need to spend our time doing that. But if you were to limit it to, when one of the bills in the last couple of years, I gave an amendment to. I had a definition of materials. I don't remember what it was offhand. I know it was not this expansive. If you want, I can try and get that to you as well too. I think it may have been on House Bill. Was it Senate Bill 324, House Bill 324 last year? But I think it's a little more broad than it needs to be, but it's not that far off.
A follow-up. Because I'm looking at the chapter 650 in the criminal code and obscene matter, and it just has basically word for word materials for this.
I'm sorry, Representative, where were you looking at that again?
Title 62 criminal code, chapter 650 obscene matter. general.
I was looking for that statute here earlier, 650. I mean, if the definition within this bill is consistent with the definition of obscene matter in RSA 650, and it's similar. I think this is broader, though. I think this is more expansive.
I disagree, but you could
Okay.
take a look at it side by side.
Sure, yeah, that's fine. And I'm sorry, I don't mean to interrupt. I may have used that definition in one of the proposed amendments I gave at one of the bills the last couple of years, so we may not be that far off.
Representative Terry?
Yeah, I think the more that I'm hearing, the more I think the answer is going to be no, but I will ask you anyway. With this being such a hot button issue, and it didn't just arise within the last year or two, has your association ever developed any model policies in response to the issue and or requests from school boards for assistance throughout the state, or made available model policies from other associations across the country?
Thank you for the question, Representative. The answer is actually yes. We do have a sample policy. We have not updated that in a number of years. It's perhaps a little thin. It does not outline a timeline or process per se. But when these challenges first started arising in 2020, 21, 22, rather than amending our sample policy and sending that out statewide, recognizing that different boards may want different processes, we certainly did some research. I reached out to other state school boards associations and basically culled resources, articles, white papers, sample policies from across the country and provided those to our members to develop their own local policies.
Follow-up?
Could you make that available to us?
Absolutely. I'll go through my files, see what I can find.
Thank
Yep.
you.
Representative Balboni?
Thank you, Madam Chair, and thank you for taking my question. We've gone through like some of the specifics in the bill. Is there anything that hasn't been brought up in the actual language of the bill that you could clarify in terms of how it may or may not work?
Yeah, thank you for the question, Representative. We talked about the definition of material, talked about sort of the age-appropriate language versus developmentally appropriate language. The 25 days back on the bottom of page 1, line 29, I think I talked about that with respect to, Dover having 19 or 18 book challenges. Talked about none of the testimony at any of the hearings over the last number of years have complained about the process per se. I'm just going through my notes. I think that's about it, at least in terms of the bill itself, aside from some of the broader policy aspects that I talked about. Thank you.
Representative Woodcock?
Thank you, and this should conclude my questions. I think I've heard almost all of it. I was going back to material, and from books that we've expanded 19 different categories here, or 18 if I count, who knows by web day, it's not gonna be huge, but 19 more categories. But I wanna go back, and you mentioned with Elvis and the shaking hips, but I'm thinking about those pieces like presentations and guest speakers, things that may come in the classroom, maybe an audience for a high school audience, those people. That prohibition to withdraw, it's already happened. And I find like, I'm reading this, I'm saying like two things. This is, we're taking this out for the future, but then as you read some of this, it's for items that already happened in the school, and you say, well, we're going to ban it. Well, you can't ban it because it already happened.
Right.
So it makes me wonder, is this going to be one step of going back to from now on, everything has to be checked, evaluated, okay by someone before they can do anything in the classroom?
Right.
I mean, I see this, am I missing that?
Yeah, no, thank you for the question, Representative Woodcock. What I think would perhaps be more clarifying, as opposed to the guest speaker who does something inappropriate, then, we can ban that person from coming back, but the incident has already happened, so to speak, would be to limit the definition of materials to physical material, and I guess digital as well too, since books on Kindles and we talked about the Sora app before. But if we were to limit it to, I'm going to call it physical material for the sake of my answer here, but rather than people, if you will. Okay. And I guess physical material could also include, posters and signs and statutes and whatever the case may be.
Okay, thank you. Thank you, Madam Chair.
Any other questions? Seeing none, thank you very much.
Representative Wood.
Sorry.
Representative Litchfield.
Thank you, Madam Chair, and thank you, Attorney Christina. I'm going to ask you a couple questions. One I should probably already know, but my computer's stumped. So right now in New Hampshire statute, do you know if we're required to notify parents ahead of time if a guest speaker is coming in?
It's a good question. Offhand, I don't know if there is any specific affirmative requirement to do that. I don't think so.
And I say that only because a couple of reasons. One, I'm super disappointed that nobody has brought up the fact when we're talking about what's objectionable or obscene. Nobody quoted Supreme Court Justice Potter Stewart. I know it when I see it because it's classic, and he's probably rolling in his grave right now, right? Because he did not want to be known for that, right? But I want to say too that when it comes to the speakers, I did have a situation in a school where I was alerted ahead of time of a speaker's local author, but when I had the chance to look up the book, I kept my child back home because it was for middle school 11-year-olds to 14-year-olds, and the book was about their only book, a young lady that got drunk, spent the night, and a sports team took advantage of her. She woke up nude, and Sharpie, their names were in Sharpie all over her body. This is what's being shown to our children. My question to you is, wouldn't it make sense for us to be consistent with, even if this is not perfect, and I know you've had everyone that's testified today has had some great suggestions for us, wouldn't it make sense for us to have a consistent policy across the state, though?
Thank you for the question, Representative. I know Representative Terry, you asked that a little bit as well, too. What I would say is school districts have different processes for all sorts of things. The process for enrolling in kindergarten is different in one district than it is in a different district. The process for signing up for the basketball team is different in one district than it is for a different district. The process for student discipline is going to be different in one district than it is in a neighboring district. So, I understand, your legislators, you make laws impacting statewide, and I understand there may be a desire to have uniformity and consistency with a policy like this statewide. Again, my response would be that, one, we value local control. We've talked about that numerous times, Representative. Our opinion is local school boards should be allowed to develop their own local policies to fit their own local needs. As I said, if you want a bill requiring a policy, no objection from NHSBA at all. And I guess the other aspect to that, I had a second thought that I was going to say to that, but I forget what it was, but I'll let it go. I had another point, but it fell out of my head. So thank you, Representative. Yep.
Any other questions? Seeing none, thank you very much. Brian Hawkins? Just
bear with the last one, that's all.
no.
Yeah, it does feel cool for this room. Thank you, Madam Chair. For the record, Brian Hawkins, representing NEA New Hampshire, here in opposition to Senate Bill 434. Not to repeat the testimony on the last bill, but I think a lot of what I have in my written testimony and in my testimony has been stated. So I'll just hit those couple of points. Certainly, school districts, it is a good idea to have a reconsideration policy for school materials, and I think all of the school districts, in the quick look, certainly on the Senate Education Committee, but also on this committee, have policies, and so I don't think we want to. I don't think there's any reason to override some of those policies, those reconsideration policies. It was raised earlier about the subjective nature of terms that are undefined, like what is offensive, or a lot of things that can offend people, and so that's very broad. And then finally, it was raised about some of the specific processes themselves. a concern we'd have about the prescribing the timelines here. I think it's important to make sure that especially if it's a parent, they have some idea of, timeliness of their complaint being addressed. That's important. But it would, our concern would be, we want to make sure that, for especially for some small school districts that are, resource strapped, or if there was a large number of materials being challenged, that it can accommodate for that. Also, some school board policies that I'm thinking of, ones like I think I know Salem, Claremont, several. I'm going back to the Senate Education Committee. I apologize, but those consider bringing a team that is in the school to review. So it's not just one single individual, because in a previous iteration of this bill, when Senator Lang mentioned the principal, that's a lot. This could be a lot to put on one principal. So, happy that they referenced a designee, but I think some of the timelines could be restrictive around trying to bring, a group like that together. And then finally, I'll just, in response to one of the questions earlier from the veto of last year, the preference indicated in the veto indicated looking at the objectionable material statute. I think because that encompasses, being able to find an alternative for an individual parent's child, as opposed to potentially imposing one viewpoint on the entire school district. And so I wanted to just make reference to that. And with that, I will close my testimony and happy to take any questions. I do have written testimony I'll hand in.
Any questions for Brian? Representative Litchfield?
Thank you. Thank you for taking my question. Do you happen to know by any chance what the policy letters are? The sample policy letters are for I know you're not New Hampshire School Board Association, but it occurred to me that if many of the schools out there have a policy, they put it in the same place and they typically use the same letters, even if
I'm not
I don't mean to put you on the spot.
That's okay.
We can bring Becky up.
Okay. Wait, we didn't even, maybe he knows it, and I did.
That would be excellent for a trivia night, I'm sure, if I knew that.
So he's saying thank you.
I don't recall when looking at, the individual, some of the individual policies that I referenced, I don't recall whether there was a common, letter designation.
Okay.
So,
thank you.
yeah.
Any other questions? Representative Selig?
Thank you so much. I'm just going back to that list of materials and all the different things that are provided by the school district and thinking about taking kids on a field trip as a teacher. So the field trip is provided by the school district, and we go to a museum where there might be nude figures because it's a museum. The way you read this bill, would that, how would that fit in? Like, would they be able to object to having field trips to this museum? Is that going to block people's ability to study these things?
Well, I think that's why during Mr. Christina's testimony, we talked a little bit about the issue with the speakers coming to the school, that, they're not necessarily repeat instances as opposed to, a book or a printed material. I do think any printed matter is very broad still, though. So, but in any instance I know from even my personal, if a student is going on a field trip, there's a notice that goes out about that. There's a permission slip several permission slips that need to be signed in some cases. I know because my daughter makes sure that I have done that before she leaves for school in the morning. And so I think there are opportunities
to either raise concerns about a situation like that, or to opt out of it.
Representative Drey?
Thank you very much, and thank you for taking my question. To follow up on that, though, wouldn't you agree that the obscene material also gives places where this material is used in ways that the material is used that makes it obscene? There's like 4 or 5 of them
In the obscenity statute.
so should be taken in consideration with the rest of the statute, is my question.
Oh, I'm sorry, that in the case of, say, for example, going to a museum,
Correct.
I believe, and I could be wrong, but I believe there is a provision in there about taking into account literary value and so forth. So I would imagine that would play into it.
Thank you.
Hopefully I'm answering your question. Okay.
Any other questions? Seeing none, thank you very much.
Thank you.
That's okay. Yep. Deb is next.
Okay, I'm sorry. There are 2 policies, IGE, which is parental objection to specific course material, and IHAM, and IHAMR, which is an additional form, but health education and exemption from instruction, as well as objectionable course material opt-out forms.
Thank you very much. Oh. Can you,
I apologize. I didn't even introduce
sorry.
myself because I thought I was just saying 2
It could
things
even-
and then getting up. I apologize.
And because of me, you have to do a pink card, I'm sorry.
That's quite all right,
So it
Representative.
could be kind of a rhetorical question. Thank you for taking my question. I'm just trying to look it up right now. These 2 policies or 3 policies that you just mentioned, they are specific to an individual child or student, being opted out. This is not the material being removed from the school, correct?
Thank you for the question, Representative Litchfield. Yes, those are the priority and required by law policies that states that, yes, the board recognizes there may be course materials which parents and guardians find objectionable, and this is the way in which they can find alternative activities for their child to do during that time and opt them out of those things. There's a general policy about that. That is the IGE policy. The other policy that I mentioned is specific to the health and sexual education curriculum opt-outs as well. However, the opting out forms could be used for both issues.
Thank you.
Representative Balboni?
Thank you, Madam Chair, and thank you for taking my question. When I was looking up the policies, I also noted that there was a policy related to public concerns and complaints about instructional resources called KEC. Would that also be relevant
to that section of our sample policies?
Yeah. Thank you.
You're welcome. KEC, yes, reconsideration of instructional materials, and KEB is about public complaints for specifically to personnel, employees, etc. But they would go together. But reconsideration of instructional materials is KEC.
Any other questions? Seeing none, thank you very much.
Fill out a pink card. I apologize to Ms. Howes, who I believe was waiting next.
Deborah House?
Let's see, this is on. Great. Good afternoon, Madam Chair, members of the Education Policy Committee. I'm up here for the first time today. My name is Deborah Howes. I'm president of the American Federation of Teachers New Hampshire. We've got 3,500 educators and public employees across the state, mostly in pre-K through 12 public education. And I am here opposed to Senate Bill 434. We've heard a lot about how this is a process bill and how it gives parents the right to challenge materials and books in our public schools. And, certainly I think it should be easy for parents and guardians to understand if they want to challenge something. But I do not think a top-down, one-size-fits-all process as described in this bill is the right process, because what we haven't heard a lot about is students' rights. Under our Constitution, students have the right to a robust public school education, and as recognized by the United States Supreme Court, students have a right to access a wide variety of materials in their schools and in their school libraries. And this process, as it's outlined, will get in the way of that. So that is my main concern, is the process as described does not balance those rights appropriately. And why adopt a process that's going to be challenged and isn't going to protect the rights of everyone who the process would cover? So as described, it has some pretty vague standards in it. We're talking about material that a complainant describes as offensive or age inappropriate, and that is very subjective. It is going to differ from one person to another. It does refer to harmful to minors and refers to another section of law. But, looking at that, many people misunderstand that harmful to minors section of the law requires the material to appeal to prurient interest, depict sexual conduct, and lack serious value, and have to be considered as a whole. So not just the most shocking scene or most shocking page or two of a book. You've got to look at the whole thing. When people misuse that, they might think something is harmful to minors or pornographic when it's not. You've got to look at the work as a whole. Nowhere in this bill does it require that the challenged material or book be considered as a whole. So that's one major concern I have about it. It places tight timelines on principals or superintendents, whoever it is you're envisioning is the one receiving the complaint and having to act on it. It does say superintendent. I know earlier discussions had talked about the principal being closer to the school. That's very hard to respond to because both of those people have a lot of responsibilities already in our education system. You've got 10 days to either read a whole book, consider it, whether it's got any educational value to students, discuss it with educators who would know, maybe convene a committee on it, and then decide whether it has value or fails this harmful to minors test, which is based on a different Supreme Court decision, by the way, U.S. Supreme Court. So there's something to this. There's validity behind it. It makes it easy for a complainant to pressure schools into removing books. So it is indeed a book and material mechanism that makes it easy to get stuff removed, makes our students' educational environment less challenging, less full of ideas that may be entirely appropriate for them to encounter. You might want to discuss what age that's appropriate at, but this doesn't balance their needs and their rights with the complainant's rights. Another concern about this, nowhere in here does it say the complaint, the nature of it, that something's being challenged has to be made public at any point before the appeal to the school board. So if you think something really should be in the school and someone else finds it offensive, you don't know about it until after it's already gone, after that whole decision process has been gone through. So we don't have to necessarily look at the work as a whole. We don't have to necessarily have a committee. It could be one person making the decision. There's a lot of holes in this, and it's not going to pass a constitutional review because you're not balancing the rights of everyone. So I have written testimony prepared, and you will get a chance to read it. I'm probably running out of time. But yeah, when our students lose access to diverse and challenging texts, they lose opportunities. So for the rights of our students and the rights of our educators, I'm urging you to ITL this bill.
So I do agree with you about the taking it as a whole. I think it's really important to set a very high bar when you're reconsidering books. I think, so SB 33 had that language in it. Everything that you said was in SB 33. It set a very high bar. It would have made that decision objective rather than subjective. But I believe you oppose that too, so.
Is there any?
I would have to go back and look and see what concerns I had about that. I think it also did not meet some of the constitutional challenges. But this certainly doesn't, the timelines are too tight, the pressure is too high, and there's nothing that protects mostly the students, but also the educators from feeling the pressure to not choose anything that might elicit objections. So it leads to that self-censorship. Should I put that poster up on the wall or is someone going to complain? Should I choose this book for my classroom library or is someone going to complain? If we self-censor to avoid complaints, students' educational opportunities get poorer and they're the worse off for it. Thank you. That's really my point. Yeah.
Representative Litchfield?
Thank you. Thank you for taking my question. I'm curious if you've seen many of the books that have been challenged right here in the state of New Hampshire. I have probably a dozen of them that I've ordered at home, but they are very graphic, because they're graphic novels, very graphic pictures of, there's one where there are several men having sex with one woman. There is someone giving oral sex or someone ejaculating into a tiny water bottle. I mean, that's just the tip of the iceberg. Have you seen any of these books? And if not, I'm happy to share if you're willing to see them. And I mean that in a respectful way, because I want you to share with me and I want to be able to share with you.
So we're back to harmful to minors or the Miller test, and it's a 3-pronged test. So, if we're evaluating things, we have to look at prurient interests depicting sexual acts and lacking serious value. So you would have to consider the work as a whole. And these graphic novels certainly would not be something you would want at your elementary school or your middle school, but they may be appropriate at your high school for some students in your high school, because they may be appropriate in your high school library as a book of choice for some students to read. That is a choice that some parents say they are fine with their children reading. Why should you decide that for every other parent and every other child? Why should I decide it?
Well, I just think it's taxpayers paying for it. But that being said, we agree to disagree. I'm just curious, would you be willing to work with us to improve this bill in a way that you're comfortable? Would you be willing to send us suggestions?
Dover has a very robust materials reconsideration policy that does involve forming a committee where they've got educators on it, and there is a chance for public input to it. That kind of process where people know what's being challenged and when there's going to be time to read it and people have a chance to give their opinion on it would be much more appropriate and would pass constitutional muster. So that would be a much better model than what we see outlined here, with its tight timelines and its pressure to remove things because of one person's opinion who finds it offensive.
Is that what you had sent to us earlier, or was that something?
No, earlier I sent a court opinion because I heard questions asked about what the status was of the court opinion on the overturned divisive concept law.
So would you send the model policy, please?
I can get the Dover policy and send it to you, yes.
Thank you.
You're welcome.
Any other questions? Seeing none, thank you very much. With that, we'll close the hearing.
You guys got a PDF earlier?